We are ready to go.
Okay, fire away. So to me, getting medications right is really important. So my favorite prescription is, I'll write you a prescription, 30 to 60 minutes of exercise daily. And if you do 30 minutes of exercise daily, you will actually decrease the chance of a heart attack by 25%. And if you exercise 90 minutes most days, you will have a greater success at weight loss and weight reduction, and your quality of life gets better. So that's my favorite prescription. Prescription number 2 will be anything that's white that you eat, make it green. And as you know, is half your plate should be fruits and vegetables. So those are the 2 starting points, is that we as a population don't exercise and don't eat well, and we get chronic diseases such as heart disease, congestive heart failure, diabetes, hypertension, overweight, Alzheimer's disease, and certain cancers. So there's so much we can do with diet and lifestyle changes. There's also a lot more we can do with pharmacological agents, and so let's explore all that. Now, what are you guys seeing on your screen? On my screen, I'm seeing all of you guys. Are the slides on there yet?
They should.
I can see the slides.
Okay, so I have to probably just go off and on over here, and I'll join you guys in a sec over here. So why don't you take it away there, Paul, and I'll just reset myself.
Sounds good. Okay, so thank you all for joining us. Today we're going to be talking, like Dr. mentioned, about prescription renewals and about medications in general, and why some sort of habits and tips and tricks we should keep in mind when we're on medications. So we have a few slides to start off, just in case some of you are new to the webinars, or even if you've been watching the webinars for some time and you'd like to get a little bit more comfortable doing that. So some webinar reminders for those of you who are in the WebEx. Make sure your microphone is muted. The reason for that is because if a lot of us have our microphones unmuted, then it can cause a little bit of static. So if you're on WebEx, the bottom of your screen, you're going to see a mic option. It looks just like that one in red right there. So make sure it's red. That indicates that your microphone is off. If you're watching on YouTube, you do not need to worry about this. Same thing goes with the video. We love seeing faces, especially in a time such as COVID. Seeing faces helps us connect a little bit better. So if you'd like, turn your video on. So look for on WebEx again, look for the camera icon there. Just hit it and you can turn your video on. And chat, if you have any questions on WebEx, you can feel free to leave a message in the chat. If you're watching on YouTube, we have a little tips and tricks there as well. So you just go to the next slide there, Stuart. So on YouTube, you can also participate in chat. So on the right side of your screen, you should see a chat box. You do need a YouTube account. So if you don't have a YouTube account, it's present in the top right corner. You can make a YouTube account and then you can leave any messages, questions, concerns, comments that you have, and we do address these in real time as well. Unfortunately on YouTube, you're not able to join in with a video or microphone. If that's something that interests you, we have some videos on our channel that discuss how to join in on WebEx. Also in the newsletters where we send the link for the webinars, there is a little document that discusses how to join in on WebEx. So if you're up for a challenge, you can always give that a shot, or you can contact us and we can help you out with that too.
So it's kind of interesting is that we have all these webinars and these videos because of Munson McMaster's young people that has taught me how to do things. I make lots of mistakes. I call them at different hours. I get stuck. I'm just proud of myself. I just got myself unstuck because about a couple months ago I would be calling Paul, Stuart, anybody else I can find. What do I do next? But all I had to do was disconnect, reconnect, and off we go again. And so good for me for a change. Skills. And if I can do it, you can do it. And I'm having some fun trying because what's happened right now is that if you're, is that you want to get a COVID test, you have to book it online. Now many labs won't take you for a walk-in. You have to book things online. Your healthcare card expires. You have to go online. We're learning and we're getting better at this. And one of the things that we still have problems too. Our website is down. We're working at getting it back up again. We'll figure it out. And so if we can do it, you can do it. We can all learn together. And also, I have to give my hands off to Sonia, who has a whole bunch of series on how to use technology better, from setting up a simple Gmail account to how to use Zoom, how to use WebEx. And she calls people on Friday nights and Saturday mornings. So if you want a helping hand, she'd be glad to help you. And also you're going to hear from Monica shortly. We have we're trying to design an app for the clinic, and we want your feedback. So take a look at it, and we want to give you what's important to you right now. One of the things is that I'm getting mad at people for not trying to get healthier and get better right now, because what I've learned is that most Canadians aren't healthy. Less than 30% exercise on a regular basis, and over 80% of the people I see in my clinic are overweight, and you're killing yourself. So let's actually stop doing that and work in this right direction. Now, getting medications right is really important. So, and how to learn better. And Paul's going to start off in teaching us how we learn and how to remember. And there's so much more to go from this. So I'll be quiet for just a little bit. Fire away there, Paul.
Okay, so Stuart, you can just, there it is. So I have a couple tips on learning. A little bit of an introduction. My name is Paul, and I'm a medical student at McMaster. You can imagine in med school, there's more content to learn than you will be able to remember in your lifetime. They tell us right from the start, you need to get comfortable with the feeling of not knowing enough. With that being said, I still try my best to learn as much as I can. And when you're learning this much, you have to figure out ways to make information stick. You could learn something one day. We could be watching this webinar together tonight, and tomorrow you could go on with your day and remember maybe 2 seconds of the webinar, 10 seconds of the webinar. You know, our goal is by watching these, we're helping you learn. Us, ourselves, are also learning. And so we need to think of some ways that we can make this information stick and we can apply it to our everyday life. So I read this book called Make It Stick, The Science of Successful Learning by Peter Brown, Henry Roediger, and Mark McDaniel. So these are 3 Harvard doctors or PhDs who study the psychology behind learning extensively. And they wrote this book called Make It Stick. It's entirely evidence-based. It looks at randomized control trials, it synthesizes randomized control trials, which is the highest quality of evidence, as well as some observational trials. So they use evidence to see what has helped people the most in learning. And when you're watching these webinars, these are some things that I want you to keep in mind, not only for tonight, but for all the webinars that you've watched in the past and all the webinars you will watch in the future. I broke it down, I summarized the book into 3 simple tips: spaced repetition, active learning, and test yourself. So the first way to learn effectively and make things stick so that you can, actually take what we're talking about tonight and apply it in your everyday life is spaced repetition. So I'm going to break that term up into 2, the repetition part and the space part. The repetition part is quite simple. It's a process of learning and relearning. So thankfully we have all of these webinars saved on our YouTube channel. And if you just go to YouTube and you type in Dr. Kearney, all of these webinars will show up, and you can re-watch these at any point in the future. We are in the process of backing all of these up too, in case anything happens and we lose some of the videos. We will still have them. So repetition means learning and relearning. So it's never enough to just watch these things one time. Even Dr. Kearney himself mentions he goes back to a lot of these webinars to re-watch them and relearn some information. The next part of that term is spaced. You need time in between your reviews. In fact, the evidence shows that learning is more effective if you forget a little bit before you relearn it. So you need time to forget something and relearn it. So let's say you're really interested in tonight's talk and about medications. It's one thing, it's great if you're wanting to rewatch it and relearn, but you don't want to rewatch it every day. You could watch a little bit today, give yourself a week so you forget some, and then watch it again next week. What this does is it creates this sense of a reminder, a sense of remembering something, and strengthens the connections in your brain. The next way to make things to make things stick and tips on learning is active learning. So active learning is the opposite of passive learning. Passive learning is actually what most of us do, and even as students in elementary school and high school, and a lot of undergrad, that's how we're sort of trained to learn. We're trained to just regurgitate information and, sit there, let it all sink in. That's passive learning. Active learning is the opposite. You have to actually be interested in the content that we're talking about and focus on the content. You want to make connections, relate what we're talking about to maybe last week's webinar or the webinar before. Connect the new information you're learning to information you've learned in the past, and also ask yourself questions. One thing that I've noticed about Dr. Kearney when attending webinars with Dr. Kearney, whether it's about new research that comes out, Dr. Kearney is always the one to stick after the webinar for an extra 30 minutes and ask a lot of questions to the people who are hosting the webinar to really understand the information. And you can tell that's active learning because he's asking questions. So this is where, on the last slide, we mentioned the chat options on YouTube and in WebEx. Use them to your fullest advantage. Ask questions if you don't understand something, and that's going to help you remember more. The last bit is test yourself. So you can test yourself immediately or after, or a while after sessions. So just think back to a session that you watched or a webinar you watched in the past, and ask yourself, hey, do you remember what we talked about there? We might also come up with some mini quizzes that we can link in the descriptions of YouTube videos as well to help test you on how much you remember. So these are 3 huge tips that really change how information sticks in your brain. And, for instance, today I had a tutorial and I got pop quizzed by one of my tutors, and to their surprise, I still remembered something from 2 months ago because I've been trying to use a lot of these tips and tricks as well.
Nice. So most of us, what I remember is that in many doctors encounter, you remember about 10 to 15%. 2 weeks later would have said. So reread your notes, write notes, and having somebody else improves it by 5%. I'm not sure having 10 people in there is going to be a big change, but is that we forget and we relearn. And it's good to know that I'm not the only one that keeps forgetting most of the things I've learned. And so keep learning and keep rethinking. So Paul, that was wonderful. Thank you.
Stuart, you can head to the next slide there.
The Social Dilemma. This is really an amazing movie. It's a Netflix movie. My son, who's in engineering, said, "Dad, you gotta see this." So I don't know. Anybody seen Social Dilemma yet at all? So Social Dilemma is basically how Google and the rest of the world is influencing us. And I thought I was able to make up my choices. The answer is that I've been coerced and pushed in a certain direction. So are you. Big example is political campaigns. Is that if you're leaning towards a candidate and people know about this, they're going to direct information to you to actually try to change your behavior a little bit, to reinforce things. And it's done in a subtle way at times, and so this is actually marketing at a much higher level where you don't perceive what's happening to you. So our behavior is being changed in many ways, and I think this is something we should all take a look at. And what worries me about big industry, they don't have your heart as part of their main focus. Their focus is on making a profit if they're trying to sell you something. And if you're a political party, they want you to vote for them. And but more importantly, we need to have balance, and we're losing our balance because you can always find information to support your claim even when you're wrong. And so we need to have conversations. We need to have really openness and looking at every side of the perspective right now. And what's happened right now is that we are being forced or directed to look at things and not getting the true perspective. They're just reinforcing certain beliefs. So everybody should take a look at that. It's a marvelous piece of work. And so it comes to this, is that I see so many people that have made up their minds without knowing all the facts. I kind of think in my area, I spent the last 35 years thinking about prevention, cardiology, cholesterol, blood pressure, diabetes, and I have a lot of information to share with you. And And the best way to share this is through these webinars. So take a look at what we have to say. Am I right? I'm not sure. But I do know is that I know a lot more about these topics than many people, especially yourself, because I've been trained for this, and I spent my life, and I love this stuff, and I want you to share this with you. And I get upset with people for not really seeing the light many times. Now, I'm not saying my light is right, but mine is directed more by science and less by emotion, because we have two parts of the brain, the emotion part and the science part. And I'm really trying to help you make the right choices so you can actually have better lives. Go ahead there, Stuart, next slide. Wow. And here's, is that you can see how the Americans have gotten very polarized. And, Americans are by and large smart people, and you can see with marketing, advertising, political campaigns, how you can be directed and actually not see the other perspective as well. So political campaigns, that's where social media and the power of the internet has actually influenced many individuals. It's also led to depression, anxiety, especially in younger individuals. Interesting, I was talking to an older gentleman today, and he feels that he's worked with media in the past. He's aware of these things. He doesn't feel influenced. I think he's one of the influencers and has influenced people right now. So we are being influenced, and we need to take better attention to what's happening to us, so we don't get so polarized. We look at all the perspectives before we make up our minds. Next slide, please.
Okay.
What are you going to talk about?
Yeah, so we're going to start talking about medications and prescription renewals as well. So we have a few things on our agenda today. Open communication.
So one of the things that a statement I see from many people or some people is that I don't want medications. I should be able to do things naturally. I commend you for wanting a natural approach, but I don't want you to have a natural death before it's your time. And what's changed in medicine is tremendous advances. So you can look at right now we're looking for a vaccine for COVID-19, a brand new disease, and people are working at this. Many diseases, measles, polio, they're now gone because people have developed therapies such as vaccines. I can lower your risk of having a heart attack or stroke by 80%. I repeat that. I can lower your risk of having a heart attack or stroke by 80%. So, and part of it is lifestyle changes, and part of it is medications. We have powerful tools at our disposal right now. And if they're scientifically validated, pay attention. Go ahead there, I'm sorry.
Yeah, all right. So we have a few things on our agenda today. I'm going to start with the open communication and medication errors, and then we're going to move on to prescription renewals, medication costs, cardiac meds, and taking medications as well. So I want to introduce you to a few people. We have Mrs. J here, who's a 78-year-old lady. She loves to read, she loves doing crosswords, and she loves watching TV. She has a history of diabetes, high blood pressure, and irregular heartbeats. She was prescribed medications for all of these. She often forgets to take her medications, but she's afraid to tell her doctor this. She doesn't want to get in trouble from her doctor. Now, that might sound familiar for a lot of you. On a routine follow-up appointment with her doctor, the doc notices abnormal results in her blood testing and her other testing as well. He sees that her blood pressure and sugars are very, very high. So Mrs. J, still being afraid of telling the doctor that she forgets to take her medications, she denies it. She, again, doesn't want to get in trouble. As such, her doctor thinks that her medications just aren't working for her, and the doctor increases the doses a little bit to get the blood pressure and sugar down. Now, forgetting medications or forgetting to take meds is a very, natural problem. It's not like she was doing anything on purpose. She was able to fix up on this and got her habits a little bit better, and she started taking her medications as prescribed. However, one day, she started noticing lightheadedness and faints. So we'll come back to Mrs. J in just a little sec, because I want to introduce you to Mr. M as well. So Mr. M is a 64-year-old man. He loves exercising. he loves watching movies, and he loves golfing. Unfortunately, Mr. M has had a heart attack in the past, and he also has a history of smoking and diabetes. He's on several medications, but he forgets the names of the medications he's taking. One of the medications that Mr. M was taking is statins. Unfortunately, he's heard some rumors from his friends that statins are bad for him. As such, he stopped taking his statins as well as some other medications without telling his doctor. He knew that if he told his doctor, he was also afraid of getting in trouble, or he knew he wouldn't please his doctor. A few years later, while not taking his medications without telling his doctors, he starts noticing an increase in his chest pain. So we're going to explore a little bit about Mr. S as well. Here we have Mrs. T, who's a 71-year-old woman. She loves learning to use her tablet, especially during COVID time when technology is, changing the way we revolve around the world. She particularly enjoys video calling her granddaughters and reading them bedtime stories over the video call. Mrs. T has an irregular heartbeat and takes medications for that. She has a hard time remembering the medication she's taking. She doesn't really keep her medications list up to date. One day, Mrs. T was seeing another doctor after visiting her family doctor. Mrs. T's family doctor prescribed medications for her irregular heartbeat, but Mrs. T unfortunately forgot that she was put on new medications, and again she didn't update her medications list. As such, the doctor that she was now seeing did not know all of the medications that she was taking. Miss T herself didn't know all the medications she was taking, and so she thought the list she had there was accurate. So the new doctor she was seeing, also prescribed her medications for her irregular heartbeat, not knowing that she was already on some. One day, Miss T started to feel her irregular heartbeats increasing, as well as some lightheadedness. So if we just move to the next slide here, what do you think happened to Mrs. J, Miss T, and Mr. S? And anyone can leave a comment or unmute your mic if you want to maybe leave a comment or message on YouTube or WebEx. Do you think it might have been a worsening of their disease? Did their disease get worse?
Why don't you tell us what happened, Paul?
Yeah, so you can skip to the next slide there, Stuart. All of these, disease got worse than other symptoms. So that's one possibility. But unfortunately, all of these had something in common. And the most likely cause of their symptoms is medication errors. So Mrs. J, she forgot what she was taking. She got some lightheadedness and she fainted. The reason for that is because since she forgot what she was taking, and she wasn't telling the doctor because she was afraid of getting in trouble from the doctor increased her doses. And when she started taking her medications as intended, the doses ended up being too high for her. Her blood pressure dropped too much, and she ended up fainting and got lightheaded. Mr. M, he was the one who didn't want to take the medications because he heard some rumors about the statins and some other medications. So here, this one actually was a worsening of disease as well. So that was a message in the chat here. The disease got worse leading to other symptoms. That's true. But again, that's because of a medication and communication error that the disease got worse. Miss T forgot what medication she was taking. She forgot to tell the doctor that her family doctor prescribed something for her irregular heartbeat. And therefore, she was prescribed conflicting medications that aren't supposed to be taken together from two different doctors. So all of these, you can see, come from or stem from an area of miscommunication. Now, miscommunication can happen in many different dimensions. It can happen between a patient and their doctor, it can happen between doctors, and it can happen even between a patient and their support system. Now, being clear and transparent with your doctor is vital. It is very important to reduce the risk of medication errors. We're going to talk a little bit more about medication errors in just a second, especially seeing how common and how damaging they can be. But one thing I want to emphasize is don't worry about getting in trouble or offending your doctor. Doctors are there to help you. They're your healthcare team, and they want to help you, live a healthy life. Being transparent opens the floor to agree on a plan that satisfies both you and your doctor. I'm sure any doctor would be more satisfied with coming up with a plan that you would actually listen to than just hearing out the doctor's plan and not abiding to it or not prescribing by it. For example, Mrs. J, she forgot the medication she was taking. Had she just told the doctor that she was forgetting some of her meds, the doctor would not have needed to increase her doses. Mr. M, he might not be happy on the medications he's on, and if he opened the floor for that conversation, a plan could have been established that he is happy abiding by, and the doctor is also aware of these changes as well. And Miss T forgot the medication she was taking. Now, this could have been a miscommunication between the physician and the patient, but also between the two doctors here as well. And had there been more or increased communication there, she might have avoided the conflicting medications. So we have some things to keep in mind when it comes to open communication. And Stuart, you can go to the next slide there. So I want to emphasize this one more time. Everyone can play a role in medication errors, whether it's patients, families, physicians, other healthcare workers, etc. No one person is at fault. However, a common underlying factor in medication errors is often miscommunication. Now, miscommunication can lead to many errors like we just saw in the past few cases, but in general, it can lead to diseases being left untreated. It can lead to being prescribed medications or too high of a dose of medications, or too low of a dose of medications as well. Medications can often conflict with one another, or doctors study this stuff extensively. They know what combinations of medications to use. Miscommunication can lead to conflicting medications being prescribed at the same time. It can also lead to being unable to change medications. If you're coming to see your doctor and you don't have an updated medications list, and the doctor doesn't know what you're taking, the doctor's going to be very hesitant to change the medications. Even if you're coming in with symptoms of chest pain, you're coming in with symptoms of an increased irregular heartbeat, and the doctor has no idea what you're on, obviously for the reason and the dangers of medication errors, the doctor is not going to want to change your medications, and it's just going to prolong the symptoms that you're experiencing as well. So as you can see, it's in everyone's favor to work towards improved communication and open communication with your healthcare team. Now, how can we do that, you might be wondering. I have some tips for open communication. I said this exact same line 2 slides ago, but I want to emphasize it once more. Being honest with your healthcare team about your medications and health opens the floor to establish a plan that you will agree on while keeping your healthcare team in the loop of the plan. Healthcare workers would much rather you decide on a plan together that they are aware of than you just pretending to listen to them and abiding by a plan that the healthcare team does not know. That puts you at greater risk of medication errors. So things to consider when you come in for your appointment: consider talking to your doctor about whether you're taking all your medications. If not, if there's any medications that you don't want to take, for example, why is that and what can we do to help? Do you forget to take your medication sometimes? It's normal to forget. Of course, like we talked about earlier, a lot of us will forget things every now and then. We can maybe establish a plan that can help you remember to take your medications better, whether it's blister packs or a time of day that works best for you. Do you have preferences for any of the medications you're taking? Do you prefer one drug over another? With that being said, just because you have preferences for a drug does not mean that you won't be prescribed one drug or another. It just opens a floor for conversation and learning as well. And are you experiencing any symptoms that you think might be due to your medications? Again, the doctors are the experts here, but we do want to listen to your perspective and opinions as well. The doctors know what symptoms correspond to different medications, and so if a doctor says it's probably not the medications, while it's worth investigating, it is also important to have some faith in that your doctors are hoping for the best for you too. Lifestyle factors are also important to consider because they can work together or in place of some medications. For example, losing 10 pounds can drop your blood pressure by about 5 systolic. So losing about 20 pounds is almost the same as a whole blood pressure pill. Now, weight loss is not easy, but this is something that you can establish a plan with your physician with as well. Lifestyle also comes into play when thinking about hindrances for your medications. Maybe you're taking medications at time of the day that aren't easy for you, and so you can establish a plan that abides with your lifestyle. And communication is vital, like I said. If you have concerns about your medications, write them down so you don't forget. Bring these with you to your appointments or have them ready for your phone appointment as well. You can talk to our students or with Dr. Kearney during your appointments about your concerns with your medications. Bring up your concerns to other members of your healthcare team if you're not comfortable bringing it up with Dr. Kearney and, for example, your family doctor, and you can ask them to consult Dr. Kearney. Keep in mind that Dr. Kearney is a specialist, and he's a lot of the time the most knowledgeable in your healthcare team regarding some of the medications and systems at play. Now, it's recommended against other members of your healthcare team changing medications that Dr. Kearney prescribes without consulting him, so you can always ask for increased communication between the doctors as well. Now, you can call the office or also email drkearney232@gmail.com if you have any questions or concerns about your medications, and be mindful about your medications. Keep a good medications list, and we're going to discuss later in this presentation what a good medications list looks like. Write down your concerns so you don't forget them, and so that you can actually express these in your appointment. And keep in mind how many refills for your medications you have. Now, this is a topic we're going to touch on a lot, as well as this nice little analogy about filling your car tank.
Yeah, so as you can see the slide right here, this is a comment that we often get at the clinic when we speak to patients. So they come in and we ask for a medications list, but the most often or frequent comment that we get is that it hasn't changed and that we already have it in the system. Well, I'll just be taking you through some of the medical errors and the dangers they can bring to primary care if we don't make sure that everything is exactly as it is. So the first study, before we get to that, Dr. Kearney, if you'd like to comment on this.
Yeah, so one disease we talk about is congestive heart failure. The leading cause of deaths for many processes, such as diabetes and coronary artery disease, will be ultimately congestive heart failure. As you can see on your top left-hand part of the slide, is that there's a period of stability, then you become unstable. And it fluctuates. So congestive heart failure is a roller coaster ride, but once you're diagnosed with congestive heart failure, you can see that approximately 50% of people, unfortunately, will pass away within 5 years. That's both with people who have an injured heart muscle called systolic dysfunction, and that's also patients who have diastolic dysfunction, where the heart becomes stiff and fibrotic and works at a higher filling pressure. Now, over time is that we've made tremendous progress, specifically in people who have systolic dysfunction of the ventricle. What I mean by that, a normal ejection fraction is about 55%. Once the heart muscles weaken less than 40%, again, that's called systolic dysfunction of the left ventricle. And you can see in one study here is that overall 50% of people will unfortunately pass away within 5 years. And at 2 years, roughly 35% of people pass away in 2 years. Now, we have medications called ARNIs, Entresto, or ACE-ARB therapy. So we have ACE-ARB therapy will decrease mortality probably by about 15 to 20%, ARNIs by 28%, beta blockers by 35%, mineralocorticoids, spironolactone by 30%. Now we have something called SGLT2 receptor antagonists, decrease mortality by additional 17%. So we can decrease mortality for heart failure by over 70% with appropriate medications. Now these medications need to be monitored. You need to look after, because you can't just go on these medications and forget it, because they affect blood pressure, they affect potassium, they affect renal function, they affect blood sugar, they affect heart rate, they affect a whole multiple of factors. And is that it's tremendous satisfaction to actually take people on the brink of death and bring them back, and also to prolong life by many years. So this is just one example how mortality from a disease can be reduced by 70%, but you need to be on 4 categories of life-saving medications, and they need to be monitored carefully. You're going to see some slides about this, is that if you have heart failure, you have heart disease, you have high blood pressure, you're normal, the first thing you go to a doctor's office is something called vital signs. So you need to know your blood pressure, you need to know your heart rate, you need to know your weight. If you don't have a blood pressure machine, get one. Next slide, please. So this is actually tremendous opportunity for longevity and quality of life. And so we can actually prevent people from being hospitalized. And so when you say to me, I told you that last time, what happens when you say medications? You have the list. What happens to medical lists there, Maria? What do we know about this?
Oh, yeah. So before we get to the medication list, we'll be getting to that in just a few slides. I'm going to go over briefly the different medication errors. So like Dr. Kearney said, to really reduce mortality, you'll have to be on multiple medications. And this study, the practice study that was done in the United Kingdom, examined the prescribing and monitoring errors in the UK over the course of a year. So they found that 12% of all primary care patients can be affected by these errors, and that they occurred in 1 in 20 prescription items, of which 1 in 550 contains a severe error. Now, you may not think that these are very big statistics, but just think about how many prescriptions are sent out in a day. It could be up to thousands, tens of thousands, hundreds of thousands. And they also found that there's a 16% increased risk of error for each additional unique medication item that's prescribed. So if you just think back to what Dr. Kearney previously said, if you're someone that takes multiple medications, then you're in the population that is at a higher risk for these errors. And the table on the left just shows the top few types of errors that contribute to this, and you can see that incomplete information on prescriptions, those are strength error, they're all errors that we can prevent simply just by double checking with our primary care physicians and double checking these medication lists. Now, if you go to the next slide, this table summarizes the different age groups as well. So you can see that the risk of prescription and monitoring errors are actually higher in children and seniors compared to the age group of 15 to 64 years of age. And just going to the next slide, this study was done in Sweden, and they took a look at the electronic medical records and compared with the medication list of actual patients to see how consistent they actually are. So they found that only 16% of it is actually consistent with the patient's actual medication use, which implies that the other 84%, or 5 out of 6 medication lists used in the assessment and follow-up of the patients, are actually incorrect. Now, what makes this alarming is that they assess this after the patient has already been followed up, which means there's already been an opportunity where they could have verified the medication list with the patient. And this is why we would like to do this every single time that a patient comes into the clinic. And again, the most common error was incorrect dose, which can also be verified with this double-checking process. And
of medication. So let's pause and say this one more time, that only 16% of charts are accurate in an electronic medical record. Now, this is actually data from Sweden. I can give you data from the VA hospital system. Is that medical errors are very common for multiple factors. One is getting medications in electronic medical record is challenging and difficult. They're not easy to put in. And in our records, we put them in 2 places. We put them in your notes, and we try to put them in the medication section as well, so they're entered twice. And if a plane takes off, and is that the pilots and the crew go through a checklist. So part of your checklist when you came in, I mentioned first, is knowing your vital signs. So the first check is what Paul says: be honest with your doctor. Decide what you want to get out of the visit, and be honest what you're taking, number 1. Number 2, my next message is do your vital signs at home. Know your blood pressure, know your heartbeat, know your weight, and that never ever say again if it's the same as last time. Is check it again before a plane takes off. We don't say the gas gauge was the same as last time. The pressure gauge was the same as last time. You check. So please verify, and you can see how common this is. And since this COVID has started, we spent a lot of time trying to get medications right, and we're working on it. It's always a work in progress. It's like losing weight. Is that you fix things and then you gain weight again. So you fix things, people change, and you adapt to this. So this says it's very clearly is that most electronic medical records, most sources and medications are wrong, and you want to correct them on a regular basis. And that's okay. That's just reality, and it's and so if you want to be in medical error, keep doing what you're doing. If you want to fix these problems, let's work together. So this is astonishing data and true data. I think we're getting better. I hope we're better than 16%. But you know what? If you check and we cross-check, fantastic. We get better.
Yeah, 100%. And you can see from the first study and also this study, medication error is a global issue. And if you go to the next slide, this is the data that's taken from the Canadian Patient Safety Institute, so this applies to us, and they actually found the medication errors, or medical errors in this case, patient safety incidences, is the third leading cause of death as of 2013, right behind cancer and heart disease. And what's scary is that all of these errors are actually preventable. Now, they accounted for 28,000 total deaths of the year, and in that report, they estimated that over the next 30 years in Canada, there will be 400,000 average annual cases of PSI, costing $6,800 per patient, and also an additional $2.75 billion in healthcare treatment costs per year. Also more medical errors.
If I got this right, in Canada, 28,000 people die every year because of medical errors, because of medications. Is that right?
Yeah, on average. That's the data taken from 2013.
That's amazing. And so we talk about how to prevent deaths, and so we need to work better to make this better. 28,000 people die because of medical errors, because of medications, and so you need to be part of the solution or part of the problem. The choice is up to you. We're working very hard to improve on this. I need you to do your part too as well. And I don't care. Blaming doesn't help. Solving it takes collaboration.
For sure. So it's definitely a team approach that we need to take from both of our parts. And just going to the next slide, the World Health Organization actually decided to do something about this because they found that the global cost associated with medication errors in total was approximately $42 billion annually. That's a crazy high number. And a number of factors can actually lead into this. And so in 2017, they decided to come up with a patient safety challenge called Medication Without Harm. And just going to the next slide, this is just a brief diagram that shows what their goals are. So their goal is to reduce severe avoidable medication-related harm by 50% in the next 5 years. So we still have 2 more years to go with that, and this table just kind of shows all the ways that different components of the population can contribute, including patients, the public, healthcare professionals, just from all aspects. So again, it's a team approach. And if you go to the next slide, these are some of the 5 moments for medication safety that they've recommended, starting from when you first to take a medication, actually taking it, adding a medication, reviewing it, which we'll be focusing a lot more on in this presentation, and also stopping it. So Paul covered some of the questions earlier in the presentation in terms of communication. So it's very important that when you do have a question, to bring it up to your primary care physician or your pharmacist or anyone else, and to review it with them. And in the next slide, we'll be going over the medication list, which we put such a heavy emphasis on. So we expect every patient to have a medication list on them at all times, but also to bring it with them to clinic at every visit. So what exactly makes a good medications list? Well, first of all, it should be up to date with all your healthcare records. So it should be an accurate reflection of the medications that you're currently taking. And within this list, it should include the drug name, of course, ideally with both generic and trade names, because we know that all drugs have two different names, the dose, the amount, so how many pills you're taking each time, the frequency that you take it, whether it's once a day, twice a day, 3 times a day, as well as the time of day that you're taking it. And if it's a really good medications list, it should also have the route of administration. So whether you're taking it orally, under the tongue, an injection, or any other route. And of course, it should also include any information about any allergies that you may have to these medications. And it should also include the non-prescription medications, which could include vitamins, supplements, or any over-the-counter drugs like aspirin or Tylenol. And of course, if you've had any previous incidences or any serious adverse effects, include that on your medication list as well, so we know if there are any medications that shouldn't be prescribed to you because of that. And the next slide just shows a couple examples of different medications lists. So the one on the previous slide was printed, but of course you can also make it by hand. And a lot of patients at our clinic do come with a handwritten medication list. Again, include as much detailed information as possible in terms of name, dosage, when you take it, and it's just a good way to keep track of everything. And the slide after this shows a comparison of 2 different medication lists. One is good and one is bad. So just by looking at this briefly overall, if anyone has any ideas on what makes one better than the other, feel free to jump in and say something in the chat.
So I'm seeing 2 type lists that have things on there. Well, to me, I see this far too often. What you're seeing on the bottom is just every pill that's being prescribed by the pharmacist from different years. And on the top, I see a list, same thing, but there's also little signs what the person's taking. So I know this person is what this person's taking. The bottom list, I know what the patient's list was ever prescribed, and the list on the left, I know what they're taking. So it's really important to look at that. And one thing, I'm not sure if we're going to talk about this, is that about 25% of people never actually fill the prescription that's been given to them by the doctor. So if the pharmacist doesn't know what's happening, so one of the things that we decided to do recently, especially with the COVID situation, instead of giving you a list, we want your pharmacist, and we'll actually fax it to them directly. So that eliminates that problem. So really important, the way our system works is that we need the address of the pharmacist. So if your pharmacist is 232 Cannon Street East, I need to know that because we search by address, and we'll send it to that if you want to. So I think it's really important that getting the medications is right, and you can see that just an incomplete or a list of everything you take in is not very helpful. Where a list where you check off what you're taking, the written or typed, is really important to look at that. So now there's a comment here, it could be on your cell phone, which is okay, and that's good. The only problem with your cell phone is if you drop dead, you need someone access to your medication list. They don't know your password, so that becomes a limitation. But still, I mean, having it in different locations in different ways is terrific. And I love for people to say this. So never, ever, ever, ever say is that it's the same as last time. And surely you must have it, because you can see the research says that most of the time the list is wrong at the doctor's office. And if I'm seeing you once, twice, 3 or 4 times a year, I don't have that many chances to update that list. So the first thing is make sure we have it right. And make sure you understand why you're taking. So thank you so much, Maria, for sharing that information, because that's fantastic. And Maria's been working very hard at getting medications right, and I thank you for those extra hours and things of that nature. And everybody in our clinic is working very, very hard at this right now. because COVID gives more of an opportunity to make mistakes because we're doing things by phone, by fax right now. So we want to make sure we get this right. So thank you. Next slide, please. So this is something that we started a little while called the medication bag. So I can show you one. Is that so? At one time we would hand people this bag to people who didn't have a proper medication list, and we can actually send this out to you too as well. Is that you need to be the key gatekeeper of your medications. You're the only person that really should know without a shadow of doubt that what you're taking. And I'm really surprised how few people actually know enough about their medications. So we'll spend some time. We're actually writing a whole book chapter on just medications. I think it started off at 500 patients. We're trying to get it down, and some people are working. Maria's working on it, and you're going to meet Margaret, who's been helpful too in that circumstance. It's a pharmacist I've known for forever, and she's been instrumental. Maria, how many pages are we down to that book chapter on medication so far?
I think we're at a higher number now, actually. Yeah, I think it just got longer.
So we're going to work on that. So we want to give you information, but not too much information. But you can see it's complicated. Any other thoughts about that medication bag from your point of view, Maria?
Yeah, I just wanted to add on, the medication bag was really useful when patients would come into clinic because they can just bring all their pills with them. But now that everything has moved online, especially with virtual meetings and phone calls, even if your medication list is very long and we have to verbally go through them one by one, and the names are, of course, very hard to pronounce, we beg you to please be patient with us and to go through them one by one, because it's very, very important that we do have an updated list from you. So yeah, that'll take us to the next section of our presentation, and this is going to be on prescription renewals. Another very important concept to address. So if you're running out of pills, what can you do? How can you get more? And how exactly can you work with your pharmacist? So just starting off, we have a cute little analogy here. It's going to be a series of animations, Stuart, so you're going to have to click through a bunch of things. So let's say you're driving a car down the road, and then all of a sudden you realize you've run out of gas, and so you're stranded in the middle of the road with no gas at all. What can you do at this stage? So a few things. Maybe you can call someone or call for help and they can bring you gas, or you'll have to manually push your car to the nearest gas station and fill it up. So what if you can't get any help or any gas? Well, that could be very hazardous because the car that's incoming might not be able to accelerate and stop in time, which could result in a potentially fatal car accident. And if the area is secluded, you may have to walk a very, very long distance to somewhere that's more populated and come back for your car afterwards if your car is still there. And of course, if we're being environmentally friendly, it wouldn't be gas and it would be electricity instead. So in the same way that we keep track of our gas meter or stage, we should be keeping track of our pills. So from gas refill to prescription refill, we should be mindful of the number of pills that are left in the bottle and also the number of renewals that we have remaining for those pills. And if you click next, yeah, so this is the current setup that we have at our clinic. So what happens is you realize you've already run out of pills, so you run to your pharmacist asking if you can get some more pills. And now your pharmacist tells you that you'll have to, your pharmacist would then have to send a request to our clinic to request for these prescription renewals. And of course, we have volunteers helping out at the clinic. We'll see this, and right now it's COVID-19, so we'll give you a call and ask you if this is the right prescription. And then you'll confirm with us, and then we'll also check in with you, and then we'll tell Dr. Kernew, and we'll all together speak with you again before Dr. Kernew can actually send the prescription back to the pharmacist. So you can see here, it's a pretty convoluted process with multiple steps, and the more transactions there are between different individuals, the more chances of errors, the more chances there are for errors. And that is what the next point is about, the fact that we should be reducing these transactions because prescription renewals faxed by the pharmacist are prone to medical errors.
So one of the things, before we go, one of the things that pharmacists are allowed to renew medications. And many times I'm quite interesting that pharmacists don't want to take on that challenge and responsibility. They want to send it back to the doctor, which is fine. But you can also talk to your pharmacist and say, listen, I've been taking this blood pressure pill, this cholesterol pill for the last 10 years. Can you renew it for me? And they're allowed to, by law, to do this. They're also allowed to charge you to do that as well. So that's one service that if you have a good pharmacy, if you have a good understanding, that pharmacist who knows you can do that, and that's important. I'm happy to do this, but look at the next slide here. This is a patient. This is actually my chart of all the visits. You can see that we have a clinic note, but we have 1, 2, 3, 4, about 4 or 5 prescription renewals very, very close together. And I don't know about you, is that I don't want to get a prescription renewal about one medication at a time. How many times have you ran out of gas lately? 1, 2, 3, 4, 5 times here. That's a lot of running out of gas. And if you run out of gas, you're at the bottom of the list. Am I going to worry about? I want to worry about everybody. Is there someone who might be having a heart attack or chest pain or congestive heart failure? Is that more important, or the person who didn't think about notifying about prescription renewals? So one of my last patients today wanted prescription renewals, and they didn't. I got a note from the pharmacist. This person needs their cholesterol pill. Fine, and my next question was that, what's your blood pressure? I don't have a blood pressure machine. And then the next question is, can you listen to this presentation tonight so we can actually fix this problem? The answer was no, I can't. I don't know what to say to that right now. I'll have to listen to another day. That's fine. But this is important. This is your life. I don't want you to run out of gas. I don't want you to run out of medications. I don't want to make it. You know I'm going to make a mistake. You're going to make a mistake. So let's actually work together on this. This is so silly and so preventable. So Maria's going to tell you a plan of action right now, but you're going to hear this and you're going to say it again. Paul says we have to repeat things. Is that when you're down to your last prescription renewal, when your tank says you have a quarter of a gas left, you make plans to get your gas tank filled. So I want you, when you're down to your last prescription renewal, to contact the office and book an appropriate time. We may need to change something. We may need to update something. I want to do all your medications simultaneous as we can. So I want you to have a full tank of gas and a clean carburetor. I want everything running at full efficiency for as long as we can right now. So I'm begging you to think about how to be more proactive. I won't turn you down for medications, but you know what? I still have another 10 or 15 people to call after this webinar for prescription renewals. Happy to do it, but I would love to be able to do it in a more proactive way, and and maybe instead of just doing things at the last second, is doing things well. Do we need to jiggle the dose? We need to change something. For instance, I had a person today, nice encounter, was taking 3 blood pressure pills, and he lost 20 pounds, and his blood pressure is lower. And I was going to push the renewal button. He said, you know what? Wait a second. My blood pressure is lower. Do I still need the same amount of medications? And he was absolutely right. And so I was able to take away 1 blood pressure pill today. But that's because this person is measuring his blood pressure, is working on his health, lost 20 pounds, and we had time to discuss what the best appropriate therapy was. It wasn't just a prescription renewal. He had a visit today, and he knew that he was going to be running out of pills in 2 months from now. Wow, what a great interaction. Where the other person said, you should know my pills. I don't measure my blood pressure. I don't have time to listen to your videos. Well, I don't know what to say in a nice way, saying is that the way you want to treat your health, and is that the way we should work together so we can work better? Am I perfect? No. Am I trying to get better? Absolutely. And so this is actually important. And I want to be there for you when you need there, but I also need you to be proactive in your health. And medications is just one facet. I don't expect you to be successful, but I expect you to work hard at your health. I work hard at yours, you work hard at your health too as well. Great. Anything else you want to say about that, Maria, about that, the point here?
No, I think you covered everything in regards to this. You'll just be hearing a lot more of the things that we've already said before throughout the rest of the presentations, because again, like Paul said, spaced repetition. That's how we'll remember it better. And yeah, just going on to the next slide then. This is bringing back the slides on before. So again, it's important to note the patient receives multiple medications from multiple sources. And this is why it's important for you to go back to the doctor that initially prescribed you the medication. So always go to them first. And again, the more transactions there are, the more room there is for errors, and that could include miscommunication of the correct dosage and also confusion between the drug names, so between the generic versus trade names. And our goal is to eliminate these, or not eliminate, but reduce the number of transactions there are. Now going on to the next slide, this slide outlines the prescription refill process that we're trying to go for. So how exactly can you help minimize this medical error? And yeah, so step one would be anticipate how many pills you have left. Now, do you actually have more repeats for the medications? Be aware of how much gas is left in your tank. And if you are on your last refill, make sure to call the office to book an appointment ahead of time so we can follow up on your health, update your list of medications, and also review any recent blood work that you have. So with each of these, it could have been a long time since your last visit, so we may not know what your current health conditions are. And maybe you've been to the hospital recently and they added a few medications or they changed some of your medications. We don't know, which is why it's very important for us to get in touch with you and also to update any changes that may have been made to your list of medications. And also reviewing recent blood work. Now, this is a point that Kushi is going to touch on a bit more later on in the presentation, but monitoring how exactly your pills are working and how you're responding to them. And lastly, after all of this, we would then be able to fax the required prescription refills directly to your pharmacy. And again, Dr. Kearney's usual practice at the clinic is to prescribe 100 days worth with 3 repeats.
So that's important. Is I want to make sure that you have enough for a year plus, and that so if we decide that's the right pill for you, now the pharmacist and might give you for the first month 30 days to make sure it's a brand new pill that it agrees with you, and that's a good idea. The government sort of mandates it. I think it's a wonderful rule, but my practice for chronic medications is to give you enough for long periods of time. I also want to usually check up on you about twice a year. So if you're at least twice a year. So if you're for blood pressure, cholesterol, like to know what's seeing you at least twice a year. For diabetes, you need to check your blood sugar. You only want to see every 3 months or so. So everything's a little bit different. So I want to give you enough so you don't have to go chasing after each other, but enough that if you have a problem, you can get in contact with us as well. I think it's also important, if you go back one slide again, is that you have lots of people involved in your health, and we didn't actually put the family doctors in this over here. So the pharmacist is a crucial part of this, and the pharmacist can certainly give you good information and actually prescribe or renew medications. And I think starting next year they'll be able to prescribe certain medications. So that's actually important. But the pharmacist doesn't have your electronic total record. And I will say this to anybody, is that if John Smith's doctor gave you a medication who's an expert on that, if you can, try to get back to that individual to find out. I'll give you an example today. So there's a patient who had was taking a cholesterol pill, and their muscle CK was 993, normal 300. The person was feeling fine. What happened? The doctor stopped the medication. The family physician, all in good faith, because that was a side effect of the medication. I saw a patient the other day who had a rise in CK to 1600. What I did is didn't change the medication. The person just went to the gym and exercised too much. Repeat the test a week later, and everything's fine. So I can't expect the pharmacist or the family doctor to know as much about the medication that I prescribe. There's a lot of medications I know nothing about, and I won't comment on that. So if you're asking me how to treat a hernia or a broken bone, or how to treat pain medications with narcotics or antidepressants, I'm the wrong guy. But when it comes to prevention, I'm the right guy. And so I'll tell you what I know and I don't know, and I'll certainly give you opinions, but be very, very, very careful about this. Move forward there. Sorry, I'm sorry, I was talking too much. This is so important. So important. Get this right.
Yeah, no worries at all. And I also just saw a question from Lynn asking, how do we make sure that your office knows about prescriptions that were given when other doctors may have prescribed something between appointments with you? So yeah, that's pretty much what Dr. Cornelius.
Yeah, the answer is I don't know. So I'm only going to know when I see you. So if what we're doing right now is that I want to update your file when you're in front of me, either virtually or in person or on the phone, is that I cannot give you proper care without a conversation or encounter with you. You're not a computer, you're not a series of numbers, you are a person who has a series of issues. So for me, to help you, I need to, if you have a concern, you want to review something, we'll make an appointment for you. That's one of the reasons why I'm always late, is because I'll squeeze people in. If you have a concern, I'll find a way most of the time. But I don't want to rely on emails. I have 5,000 emails I haven't checked. If you have an issue, I prefer a face-to-face discussion, but now will be a phone discussion, and soon we'll probably have a video discussion. We're learning how to do things so much better. And I'm really proud of the team we put together right now, because they're all working to get better all the time. So that's the best I can tell you.
Yeah. So again, here's a summary of what we're going to do with prescription refills going forward. So if we do receive a call or fax from your pharmacy requesting a refill, Dr. Kearney will first renew the prescription for 30 days to start. And then within these 30 days, we'd like you to call our office to book an appointment so that we can meet with you and chat with you. And then a long-term prescription will be faxed after we have spoken with you. And the goal here is also to synchronize all your prescriptions that are handled by Dr. Kearney, so then they all have the same renewal date. And if you recall from the picture from our charts from before, there were a lot of prescriptions over a period of just 1 week. So our goal is to try to have all of them at the same time, so we don't have to refill one prescription at a time.
So what I do right now is that we try to contact you, and if I can't get a hold of you, and if you run out of gas and you call the guy to bring a can of gas, well, it's not convenient. Well, you've already inconvenienced a whole bunch of people by running out of pills, and that's okay. We'll deal with that. But this is not a convenience factor. This is your health we're important with. And if I know that you've been taking a medication for a long period of time, I'm going to see you in the next short little while, and I had seen you recently, I may just renew that prescription. But if I haven't seen you for a while, and I'm not sure about the right thing to do, I will maybe not renew the prescription, or maybe I'll give you 30 days. So, but I really want to prevent this from happening as much as we can, because you can see that medical errors are common, and it was that right, 28,000 people die every year in Canada because of medication errors. I want to do my part to make it as few as possible. I'm not perfect, you're not perfect, but the best way is Paul and everybody says, good communication. So let's actually communicate better. And so what gets myself in a boil, I say, is that it's the same as before. Or you give me a bad medication list, or you don't have a medication list. You should have it on you at all times. You get sick, you go to the hospital, people need to know what you're taking. And if you just rely on some computer to tell you, well, the computer's right 16% of the time, so good luck. If that's what you want, don't expect to be too healthy. So let's find a better way about doing this. So this is an evolution right now. So it's hard work, and like anything in life, hard work leads to good outcome 80% of the time. So enough preaching about this, but well, maybe not. There'll be some more preaching to come, but we'll keep working on this because these are fantastic medications that add quality of life to you and prevent you from being sick. And that's remarkable what we can do today.
So Monica will be talking a little bit about drug shortages, and Margaret, if you ever have anything to add, you can just feel free to jump in.
So Margaret's one of our pharmacists, and Margaret is that I've known. I don't know, Margaret. We've been around for too long, and Margaret is always a go-to person over the years that I've communicated with. And do you have any comments right now, Margaret? You wanted to add at this point in time, or add at any point in time? Please feel free. One of the things is that I wish I can work with just one or two pharmacists, and that really can have direct communications. So I will put a plug to any person whose doctor's office has a local pharmacist in their building or close by that they have direct communication. That's always a very plus because you can have face-to-face conversations. I can, like for instance, I work in a Shoppers Drug Mart Plaza. Remy's the head pharmacist here and his assistants. I can talk to them. And I have so many questions. So they know me, I know them. That's easy. It doesn't say you can't go to any pharmacist, but having someone you can talk to, there are many pharmacists, I have no idea who they are. So love your pharmacist, find a great pharmacist. Ideally, your pharmacist, your doctors, and all your people should be in the same bubble, and they can all communicate in some way, and no one gets COVID, no one gets sick, and everybody gets the right medications at the right time. But I know that's not always practical. But think about how to really make this work in more seamlessly as possible. Really important. Drug shortages, oh my God, let's hear more about that. So who's talking about drug shortages?
I believe it's Monica, but she might be having trouble with her mic right now.
Okay. So what is it? Go ahead. Are you there?
Yes.
Go ahead.
First of all, full disclosure, I am an Ontario registered pharmacist, but I'm on Part B of the register, so I'm not allowed to have any patient contact either in a retail environment or in a hospital environment. My life over the past 25 years has been spent on the dark side, as Maria said. I've been working in the private payer insurance market, but I do know about drug shortages because private payers are dealing with this on a regular basis the same way as public payers are. There was a survey done by the Canadian Pharmacists Association in 2018 which indicated that 1 in 4 Canadians have either personally experienced or know someone who's experienced a drug shortage in the last 3 years. So it's not related to coronavirus. This has been going on for many years, unfortunately. Part of the problem is that the raw materials are often coming from either China or India, and you may have 10 different generic companies that are manufacturing essentially the same product, but they may also be relying on their same source for supply. So it's not temporary, hopefully not permanent, but it is an ongoing problem. And certainly there's 2 fairly high profile ones relatively recently, when there was problems with Zantac, ranitidine, and patients who had been on Zantac or ranitidine for long periods of time had to be changed over to another drug in the similar class, which in turn led to shortage of these drugs. So then we started to get into potentially pill splitting, which can be successful in some situations, but it has very limited application. So the pharmacy team has had a lot of challenges to deal with pre-pandemic and post-pandemic. Okay.
Are you able to hear me?
Yes.
Okay, perfect. That's really great input. I think you kind of summarized things that I wanted to touch upon, maybe even better. For just a general understanding of a drug shortage is that the medication that the doctor prescribed is not necessarily available at the time, and it could be at one pharmacy or it could be across more pharmacies. And I found this really unique chart here that the approach that pharmacists take. So correct me if it's right or wrong, Margaret, but pharmacists really do try their best to supply the drugs that they can for patients. But let's say that one of your medications is not available. They have like these categories of whether it's a critical or non-critical medication. And from there, if it's more of a critical medication, they try their best to identify other locations where they can supply the drug. And if not, then they have the alternatives that they can rely on.
I guess too, one of the problems is within the provincial drug plan, ODB, there are only certain generic companies that are considered interchangeable. So if, let's say you have a brand name with 3 interchangeable products, but there might be others out there, they may not be easily sourced, and it would also mean that the pharmacist would have to may have to contact the prescriber to get permission to interchange something that's not covered, not considered interchangeable at the government level.
Okay, that's really interesting.
And occasionally there may be sharing situations. It might be possible, in fact, to get from a local hospital some of these critical drugs, but obviously in very small quantities.
Yeah. Would you say that majority of the drug shortages, are they considered critical or non-critical? So on the next slide, there's the official definition of what critical and non-critical drugs would be considered.
I'm really not in a position to comment on that, I'm sorry.
Okay.
So you can see at different times we're going to have different obstacles, but you know what? We have many choices and many ways of overcoming a lot of these things. So, and so that's why we have physicians, pharmacists, and teams to always come up with alternate plans. So, the beauty of our system right now is that we have many choices. So there's usually solutions. Obviously, there'll be inconveniences, but you know what? Most of the time, we can come up with something.
And certainly, I mean, some of the generic manufacturers have been really proactive. There was a shortage of salbutamol inhalers, and one of the major generic companies actually brought supply in from the United Kingdom. And some of these situations may be a bit of a problem for Health Canada because they might not be in the 2 languages. So they have to have special permission, and they may not actually have a DIN number. They may have to resort to using product identification numbers instead of actual DIN numbers. So it doesn't happen often, but there sometimes can be workaround.
Right. So there are quite a few considerations, such as like even the languages that would affect the ability to interchangeably use medications.
Correct. If it's not available in Canada in 2 languages, then it would normally not be accepted by Health Canada.
Yeah, that's a good point to make. I think sometimes people may feel frustrated when they're not able to take their medication. So it's good to know both sides of the story and just to hear all the perspectives and work together as a team to figure out the best solution. And that's why the pharmacists are very well educated and informed, as well as the health practitioners. So they're always there to support you however best they can.
I'm thinking in terms of the kind of drugs that Dr. Kernu is using most regularly. There's usually something else within a similar class or moving into a different class of drugs that will do the job of keeping blood pressure or congestive heart failure under control. They're not just stuck with one class of drugs, and if you've got a shortage, it's a major problem. But in some other areas where there may only be one medication, it is a major problem.
That's a really good point to make as well. Yeah, I guess drug shortages is good to hear about because it does happen. But yeah, like you mentioned, for Dr. Kearney's case, that's good to know that, like coming from a pharmacist, there are several other classes that you could rely upon if you had to. And then on the next slide, it's kind of the recommended approach that pharmacists usually take when they are finding out like how to proceed if there is a drug shortage. So you can see that the first thing they usually do is look for that interchangeable product, and if they realize it's not available, then they'll change to an alternative drug within the class, or change classes if that's allowed for the specific medication they're exploring. We weren't planning on getting too deep into the actual process, but we just wanted to inform you that there is like procedures and policies and lots of information around drug shortages to help support you through what you're going through. So if you do notice there's a drug shortage and your pharmacist makes a recommendation, pharmacists are allowed to switch your drug. But if you do want to discuss it with Dr. Kearney, you can feel free to make sure you call him and ask, this is what was recommended, do you think it's okay? But pharmacists are allowed to have that authority. If you want to elaborate on that, Dr. Kearney or Margaret.
So to me, this is an opportunity to review whether that's still the right drug, the best drug for you, and other options. So to me, it's just one more thing to do, which is fine. And so I welcome the opportunity to see, is this still we have many choices. So this is not a problem most of the time, so I'm not too worried about that.
That's good. Good to hear.
I'll just take over again and talk about the safe disposal of some prescription drugs. I took this information directly from Health Canada. So there are two ways you can dispose of it. The first being take-back programs. And pretty much all pharmacies in Canada participate in this. So at any day of the year, you can return your unused or expired medications to any pharmacy. And some municipalities and local police forces also offer take-back programs that collect prescription drugs, over-the-counter medications, and even natural health products. But if for some reason you can't access any of these take-back programs, then you would resort to garbage disposal. And if you must do this, there are 3 steps to follow. So first, remove the medications from their original containers, and of course, scratch out all identifying information on the prescription label so none of your personal information can be seen. And also, hide medications in something unappealing. Now, this could be cat litter or just anything that's not necessarily appealing for people to take. This is to prevent children from taking it, and also if someone's looking for drugs in the trash, it would also prevent them from finding it. And lastly, place this mixture in a closed bag, empty can, or any sealed container to prevent it from spilling out of a garbage bag. And again, this is emphasized by the FDA and on Health Canada as well. Do not flush medicines down the toilet or sink because there may be environmental consequences with that. Now, with this noted, if you go to the next slide, there is actually evidence proving that the expiry date doesn't determine the drug's effectiveness, which means that even if you pass the expiry date, it doesn't really mean that it's no longer effective or potent. So a study or an article published by Harvard University showed that in the U.S. military, they always have a large and very expensive stockpile of drugs. They always face toss out every few years. But the study showed that 90% of more than 100 drugs, both prescription and over-the-counter, were perfectly good to use even 15 years after the expiration date. So a drug can become less effective over time, but the study found that it retains most of its original potency. And it's also good to note that this is the case for most drugs, but not necessarily for nitroglycerin, insulin, or any liquid antibiotics.
This is important, is that 90% of drugs that if they're kept in a cool, dark place are good for 15 years. And that you mentioned things like nitroglycerin, insulin, and liquid antibiotics. And so Canada threw away a number of millions of N95 masks, and I'm sure they were pretty darn good. And at one time you couldn't get them. So I come from immigrants, and we don't throw anything away. and maybe my wife throws things away, which I should. But this tells us that the expiry date's not so bad, and 15 years out of the drugs are still good for vast majority of them. So if this excludes nitroglycerin, insulin, and most liquid antibiotics, so something to think about. So good to know. Thank you for finding that. I remember reading about that, Maria, and I couldn't find the study again. So thank you.
Yeah, no problem. Google's pretty effective these days. But yeah, so for the next slide, I'll be talking a little bit about blister packs, or you may know them as pill packs or compliance packs. Now, these are basically packages containing daily bubbles that divide the pills by days and also by the time of day patients should take them. And instead of the usual 90-day prescription, they're filled in 2 to 4 week intervals. So you have all your medications divided by time of day for every single day within these 2 to 4 weeks. Now, if you go to the next slide, this is usually good for patients who have, sorry, that's not supposed to be there, but that's, again, a good thing to note. The benefits of blister packs. So, first of all, it's safe. So you can visibly see the pills that you have or have not taken. So for people who are usually forgetful, this eliminates the errors of potentially missing a dose or even doubling up on your doses. So if you thought you took it at a point in time, but you actually didn't, or vice versa. And the next advantage of blister packs is consistency. And this allows for you to, again, keep track of what you have and what you haven't taken, so you don't have to manually remember it. And all you have to do is take the pills out of each bubble at the time of day that's indicated and take it at that time of day. So again, that reduces medical non-adherence, where patients simply forget and then they just don't really care about taking their medication. And lastly, of course, it's very convenient. So it's very compact in size, and just in one package, you can take all of your pills for 2 to 4 weeks with you, no matter where you go. So everything is in one place, and often these packages include a full updated medications list on the inside as well. So it's very portable and also easy to carry around for travel, although that wouldn't be very applicable in the current climate. But of course, there are also downsides to blister packs as well. So it does not actually have level 1 evidence to back it up, which means that no randomized controlled trials have actually been conducted to examine the clinical effectiveness of using blister packs. And also with the blister packs, because you're getting them in packages for 2 to 4 weeks, you don't really know how many pills are still left remaining in your prescription. And only the pharmacist knows, so you personally wouldn't have that knowledge. And this blister pack actually also entails an additional dispensing fee, which could be quite expensive if the patient doesn't have insurance. And Margaret, I'm not sure if you have any information on this. From what I know, I think it's $11.99 per month if you don't have insurance at Shoppers and most pharmacies, and cheaper at Costco, around $5.99. But yeah.
Yes, I managed to get hold of some current dispensing fees today, and Costco is certainly the least expensive, around $4.49, $4.99. Food Basics, Metro, $8.99 to $9.99. Walmart, you would have thought might have been less expensive, but they're running in the $10.49 to $11.99 range, and Rexall is probably the most expensive at $12.99. Shoppers are running $10.99 to $11.99. So if you are on multiple medications, having these filled every 2 to 4 weeks is an expensive proposition, and some of the insurance companies will not pay for that.
It's quite interesting is that I think it's good to have choices, and for some people, keeping things in a bottle is a good idea if you're taking a few pills, and you can keep track of that. For people taking multiple pills, especially if you're more forgetful, having a blister pack is important. Also gives ways for family members to check up on you, other people as well, because many of us make medical errors. So if you find pills on the floor somewhere, that's a sign. Or if the bubble pack isn't being properly used. So I'm encouraging people to always bring their pills and their bottles and their bubble pack. And also, you should bring the bubble pack back to your pharmacist for the pills that you haven't used, or to your doctor's office, so we have good discussion about this. So it really comes back to really being open and honest about what you're prepared to take and not prepared to take. Many people have opinions on things based on poor science, and it's good to talk about it, and so it's good to sort things out. So I think there's a lot of pluses to blister or bubble packs. I think there's also some downsides too as well. So it's a great discussion to have with your pharmacist and your doctor to decide if that's for you or not, and it's great to have that option. And again, many pharmacists will deliver to people locally around here, and dispensing fees, while they're important, the quality relationship which you have with your pharmacist is, to me, the key. If you have a good pharmacist, a pharmacist has to make a living, and that's not a lot of money that they make. So to me, healthcare is a challenge these days, and I love working with people who just want to get better. I want patients to get better. I want to work with the pharmacists who have your best at heart, and so we'll all work together. So this is actually important to have these options. Also, delivery is important too. So how you can get the pills, who's going to pick them up, and those are things you need to consider.
Yeah, it's good that you brought delivery up, because on the next slide, there's something that Margaret also talked to me about, the different COVID-19 pandemic challenges right now. So of course, delivery to patient homes may take longer in terms of medication. Even though there's a lot of pharmacies do offer curbside pickup, it still makes it harder to actually get in contact with the patients and actually speak with them. Again, with doctors' offices being closed, it's hard to get the prescriptions. Staff shortages, patients who may have lost their benefits or no longer have coverage, they can't afford more expensive medication, which is even more of a challenge currently because they may need their medications even more. And also, of course, more mental health or addiction issues, and finding alternatives to offer to prescribers when there are significant long-term shortages of popular drug classes.
Really important to let people know about cost, and we're going to spend a lot of time talking about that. Don't be embarrassed to say, I can't afford this. And we're going to talk about this. So we're all part of the same team, and again, multiple ways of looking at it. Some people say, I want the best, cost is not a factor, and that's some people. Many people have a limited budget, and including myself, and so to me is, you know, dealing within your means is important, and don't be afraid to talk about that. So I'm really excited about we're going to talk about this. And by the way, what I'm encouraging everybody, I'm getting some more soup as well. Eat, have a cup of coffee. I got something in the microwave. I'll be back in a second, but let's talk about cost of medications. Please eat, everybody. Healthy, of course.
Yeah, so for the next slide. Oh yeah, so I'm just ashamed that Dr. Krieger is missing this, but this is something that he did want us to emphasize, and it's that the government often makes promises in terms of prescription medication, and yeah, here's Trudeau and Trump having a conversation, but we just like to outline how exactly, or how expensive prescription medications really are, and the amount of federal spending that we spend on that. So from Statistics Canada, they said that Canada's total health spending is expected to reach $254 billion, or $7,068 per Canadian. And prescription drug spending in Canada has risen from $2.6 billion back in 1985 to $34.3 billion now in 2019. And so in 2019, approximately 43.1% of the $34.3 billion of prescribed drug spending was actually financed by the public sector, so by our government. And the 36.9% was financed by private sector, so that could include insurance or pocket money. And the remaining 19.9% was financed by Canadian households. but really the bottom question comes back to who should really pay for our medications, who should pay for these prescriptions and drugs. Yeah, Monica, if you're there and you want to take it away with the dispensing fee.
Yeah, so I think Margaret actually covered the updated dispensing fee costs. These were the costs that I found from a report from 2018. I couldn't find the 2020, so they've increased. But Costco is still the cheapest based on the trend. So I guess that's just good knowledge to have. But as Dr. Kearney mentioned, the pharmacist and quality relationship you have with your pharmacy is also as important to consider. So if you're not able to necessarily go to Costco because it's the cheapest, but you can afford to go somewhere else and maintain that relationship with your pharmacist, then that's also encouraged. But sorry, go ahead. Yeah.
Could I just add that some private payers are required to go to a specific location or a specific provider, otherwise they pay more. So it could be it's a preferred provider network. So the employer or the insurer has negotiated with a provider to basically have sole ownership of dispensing in order to get the best price.
Also, too, these are all, your local pharmacist relationship. They can change things for you too as well. So I'm really impressed at many good pharmacists who go and help patients and change a lot of the costs too as well. So these are the listed prices. What you will pay for, it depends. So that basically saying is every time you go for a prescription renewal, you will pay roughly $10 for a renewal fee for every drug. So if you're having a drug every 3 months, that's one dispensing fees. If you're having it every month, you'll pay more of a dispensing fee. And but please keep that in mind. And to me, is that I think some wonderful pharmacists. I can't say this enough. Is that I'm really impressed with the pharmacists I work with in this building. They're wonderful. I know some other great pharmacists too as well. It's nice to have communication. Some other pharmacists I just don't know, and they don't know me. So it's very interesting to who's in part of your healthcare team. So but please discuss costs with your pharmacist, your doctor. Pharmacists are good at drug interactions, but a lot of these drug interactions are very theoretical. And one of the things that Maria just told us is 90% of your drugs that are outdated are still good. So you don't have to go rushing to renew them as quickly as you think. So remember, is it nitroglycerin, liquid antibiotics, and what was that third drug again? Third category?
Insulin.
Insulin. Okay, so those are things, and how you properly store them and things of that nature as well. There's certain things that need to respect about that. So those are things to think about. So great, thank you. Keep going on. And everybody, eat, drink, and be merry. Healthy, of course. I'm getting my next bowl of soup.
Yeah, I think we've covered the most important aspects of this topic, so we can move on.
I think now Simon will just take it away with the different cost comparisons of all the different medications.
Yeah, so we're just going to be briefly looking at some of the difference in cost and the different types of medications here, but I'll go into more detail in the later section to talk about the functions and some kind of the medications and what they do, looking at the cholesterol medications. So we have the statins here, right, Lipitor and Crestor. So we're looking at about 20 cents a day. But for ezetimibe, it's also quite a cheap drug. We're also looking at 20 cents per day. And we have this Repatha, which is a new class of medication called PCSK9 inhibitors. It is quite a potent drug. It lowers your LDL level by about 60%, but that does come with a cost with about $70,000 per year, and the company pays for half of that. So when the customer actually pays for it, it's about $35,000 a year. And we also.
So we actually just pause there for a second. The first question is, which is better? So if price wasn't determined factor, what would you take, Simon? Would you take PCSK9 drug by this injection that goes to the LDL receptor, or would you take a statin and a ezetimibe? What do you think?
Yeah, I think, so first of all, like pros and cons, like in terms of Repatha, again, like it lowers LDL by a lot, about 60%, and we don't see as much side effects as we see in statins. It's a very well-tolerated drug. And however, it is injected, so the injection method is not very popular to some of the people. I think Repatha comes with a lot of benefits comparing to statins, where you have to take a really high dose, about like I think 80 milligrams for Lipitor and 40 milligrams for Crestor, to have the same effect, about a 60% decrease in your LDL level. So if we are not considering the cost, I would probably go with Repatha for myself, just because some of the benefits, and also we don't have any side effects with Repatha. Yeah.
So it's kind of interesting is that I would take Lipitor and Crestor and ezetimibe. Why? Because they've been around for a long time. We know them. They work. They prevent heart disease. Repatha is a superstar. But its track year record's quite short. And you know what is that we can actually lower the incidence of heart disease by 60% by taking high dose statin and ezetimibe over a period of 5 years. Repatha can lower the incidence of heart disease by 20% over 2 years, maybe 3 years. So we don't have a good data set on that long term. Needless to say, I think they're both phenomenal choices. The fact is, the drug is listed at $7,000 in Canada. You're right. That you can get a private deal if you negotiate wisely. The company is not too sharing of that information, but basically, if you have no insurance and you pay for it by cash, you'll get between 30 to 50% discount. Which is still tax deductible, but still a lot. So, when you have something that's been proven of value, and it's very safe. So one of the perceptions is if you Google statins and side effects, you get 1.3 million hits, saying what a lousy drug it is. And if you remember the first slide we talked about with the internet data about changing subtleties, so there's been a lot of advertising to say that vitamins and different supplements are something that you should be taking. The reality is that when you study vitamins, they don't work. The only proven supplement right now is pure EPA that lowers risk of heart disease by 25%. And the standard omega-3 fish oils that you buy are not pure. They don't work, and people are spending billions of dollars. So I'm quite impressed how the internet and how marketing has changed science. So one of the things that before I die is that we have level 1 evidence, as Maria talked about blister packs. They don't have level 1 evidence saying that they're definitely better the other way around. It's a common sense approach. I think it's a good common sense for many people being on a blister pack, but for other people it's not the right choice. But I will say this is that when you have proven value over 200,000 patients have been randomized to statin therapy, it's safe and effective. You just don't have that literature in your drugs. I'm not saying I don't trust the newer drugs, but I love what's safe and proven, and getting good value for the dollar is great at this point in time. So it's great to have all these tools available. So we can talk more about that, but wonderful news to know that the price that you pay and should pay for, and that's great. Go ahead there.
Yeah, absolutely. So, and so the following 4 slides are just sort of an overview of what we'll be talking about later on. So we're going to talk about, again, cholesterol medications. And so next slide some antihypertensive medications, and anticoagulants and COPD medications, and then if we move on to the next slide, and some diabetes medications. And now I'll be sort of going over them in a bit more detail by talking about the cardiac and related medications on the next few slides. Yeah. And the next slide, actually, I'm sorry. Yeah, so we basically just talked about cholesterol medications, and just to do a bit of a recap, when you have a lot of cholesterol in your bloodstream, that causes a buildup of plaques. So a high level of blood cholesterol increases the risk of cardiovascular disease, such as stroke or heart attack. And statins, which are the most effective oral cholesterol medications, works by disrupting the cholesterol production in the liver, right? And Lipitor and Crestor are both examples of common statins. And we have talked about the statistics before. They lowered LDL by 50 to 60% on higher dosage. And some of the reported side effects include muscle aches and also muscle soreness, and also raising blood pressure and fuzzy headedness. Raising blood sugar often occurs for those who are already at risk for diabetes and will rarely.
I'm going to stop you there. Some requirements, so I'm going to stop you there for 2 seconds.
Yeah, sorry, for sure.
Sure. What I'm saying is that sorting out science and non-science are important to understand this here. So muscle aches is if you actually go back to the raw data, is that 10 years ago or 20 years ago, the trial called Miracle. 10,000 patients got high-dose Lipitor placebo. 2% of people complain of side effects on statins. 2% of complain of sore muscles on placebo. If you ask the same question today, 30% of people complain of side effects on statin therapy. And if you look at the placebo-controlled trials, there's really no difference. Rise in blood sugar, it basically makes you diabetic about 6 months before you're going to become a diabetic. It raises blood sugar by 0.1 millimole. So if you're going to be diabetic at the age of 55, going on a cholesterol pill, you're going to be a diabetic at 49 and a half years of age. In fact, it doesn't cause rise in blood pressure. So a lot of these things are perceptions, and I don't want to spend too much time talking about here today, but I just want to mention that cost is a factor, and you need to really talk to people in the knowledge about that. Let's go to the next slide about this here. Repatha is a phenomenal drug, and pralin's another phenomenal drug too. It can lower LDL cholesterol by 60%, and it's been shown to reduce cardiovascular events as short as 2 years by about 20% or so. Same thing with Praliant. The list price is $7,000, but is that if you can get, the companies will give you a discount between 30 to 50% down to $3,500 at this point in time. What the price will be as time goes on, don't know, but they're still quite expensive. They're no better than a statin and ezetimibe, and their safety issues. All these drugs are very safe. Next slide, please. So I love these drugs, but I also think it's important to think about how we pay for this over here. And here are the costs again. Is that for 25 cents a day, or between $3,500 to $7,000, you get the same effect on the cholesterol. You have proven benefits of statin therapy. There's other effects too as well. Next slide, please. These are wonderful drugs, but I need to look at this over time. This is actually the European guidelines, and I love the European guidelines, and I don't want to spend too much time talking about this, but if you get an LDL cholesterol to less than 1, you can actually promote regression on an angiogram. So we're getting more aggressive about that, and to that needs combination therapy. Next slide, please. Lots to say, lots to do right now. Why don't you tell us about the different names of the drugs here, Simon, about generics and trade names. What's all that all about?
Yeah, so here we have the 3 common classes of antihypertensive drugs, and each of them have their individual modes of action, so they function differently in their body. And the 3 common ones here are the ACE inhibitors, and they all end with a PRIL, as you can see. And the second category here is ARB, and all of the terminations and star text. You can recognize them by looking at that ending, and also water pills. And these are the three common classes of drugs we have patients go on for hypertension. And just going into the next slide, these drugs are mainly used to lower blood pressure. And just keep in mind that some of the medications will be used for more than one thing, like water pills are often used to reduce swelling. And some of the side effects here include increased potassium levels, because the water pills does interfere with some of the pathways in your kidney, and also dehydration. So that is some of the side effects we see in these medications. And going on to the next slide, it's just a review of the cost comparisons between the three classes of drugs and some of the options we have within each class. So they are relatively not expensive. As we can see, they're about 10 cents per day, or 40 cents per day for the ACE inhibitors. And for the ARBs, they're also quite cheap, 30 cents per day, and same thing with the water pills. Yeah. And just moving on to the next slide.
If you could just backtrack one slide there. You notice that there's two names to the drug. I want to ask Margaret between trade names and generic names, and same thing with Simon too as well. So we'll get Margaret to go through this first. What do you think between a difference between a trade name drug called, let's say, Ramipril or Alteplase as a trade name versus a drug name as Ramipril? So Margaret, what do you think between generics and trade name for drugs?
Well, I think the trade names are a lot easier to remember, particularly as you get into the more complex drugs. I'm thinking about the monoclonal antibodies that all end in MABs. I think it's a lot easier for a patient to remember that they're taking Alteplase and not Ramipril. Fortunately, the medication labels these days have got both the names on it, which is good. Even though you get the generic brand, it will say equivalent to Ramipril or whatever it happens to be. Does that help?
I can jump in here. So for generic versus trade name, yeah, like what Margaret said, trade name is definitely easier to remember, but the generic name is usually the active ingredient that actually makes up the drug. And then different companies produce the drugs differently, and then this is what the trade name is based on. So it's also known as a brand name, depending on which company it's produced by. So in this case, let's take furosemide, for example. It's a very commonly seen water pill that's prescribed, and furosemide itself is the active ingredient that makes up this water pill, and then the company that produces it is Lasix, so then that's where the trade name comes from.
So to me, you pay a lot for the trade name. The active ingredients are still the active ingredient. So I think they're all pretty interchangeable. And some people feel very strongly about the fillers and the way they get there to be a little bit different. And so for most people, I don't think it makes a difference. But if you want to pay a lot more for the brand name, by all means, you certainly can. And but for me, most of the time, I don't think makes a huge difference. Simon, what do you think between trade or brand names? Do you have a preference?
Yeah, I think from what I have seen on, like a lot of the patients prefer the trade name because it's easier to remember. Like, take the example of furosemide, like Lasix is much easier to say and easier for patients to remember, I guess. But I guess they're kind of interchangeable. Yeah.
So when I say Lasix or furosemide, it's the same drug to me, and doesn't matter who the manufacturer is. If they meet Health Canada's standard, I'm happy.
Can I just also add, Dr. Carnew, that many of the older brands are no longer available, but people still remember it by the original brand name. So I doubt if you'll find Lasix anywhere, perhaps as an injectable, but not as an oral product.
Fair enough. Thank you. So it's important because, as we point out, we're paying a lot more for medications, and getting good value for what you're doing is important. So I thank you for looking at this. Tell us about this trial here, Simon. This is an important trial.
Yeah, so basically we have this trial done by the about blood pressure lowering for prevention of cardiovascular events, and this massive trial involves about 348,000 participants, right? And what we have found is that blood pressure medications lowers the risk of heart attack and cardiovascular events, such as heart failure and strokes, regardless of the baseline BP. And even in patients without history of a heart disease, right? And the statistics here is that for every 5 millimeter mercury reduction in systolic BP, we can reduce the risk of an event by 10%. So if you lower it by 10 millimeters mercury, that's 20%, right? And the medications reduce the risk of stroke and ischemic heart disease, heart failures, and death from cardiovascular by 13% and 14% and 5% respectively. So that is kind of the trial that we have seen, and that's some really interesting data that through a decrease of blood pressure, we have seen a significant reduction in the risk of cardiovascular events. Yeah.
So thanks for sharing with us, Simon. This is actually a meta-analysis of randomized controlled trials in hypertension. So they took all the trials that had hypertension that were randomized level A evidence to basically real pill and placebo, and they had almost 350,000 patients. And they showed a stepwise reduction in risk of heart attacks, strokes, and congestive heart failure for every 5 millimeters reduction of blood pressure down to normal blood pressure down to 120 range. So we say, a normal blood pressure is around 120 over 80 range. And traditionally in North America, we tend to treat when the blood pressure is 140 over 90. What this shows is that regardless what your blood pressure, and it all comes in with hypertension, that for every 5 millimeters reduction of blood pressure, good things happen. So lowering blood pressure or for longer periods of time, lower incidence of heart disease, better effect in congestive heart failure, and a better effect in stroke. So this is actually huge. And that's why people say, when should we stop? Certainly if you lower blood pressure too much, you can make people feel dizzy and can pass out. So you have to be careful about that. You can't lower LDL cholesterol too much, but lowering systolic blood pressure translates to remarkable benefits. And so you and your doctor have to decide for you, because some people have fluctuating blood pressures, and you need to measure the blood pressure. We have lots of videos on how to measure blood pressure as soon as the blood pressure is sitting quietly. You don't measure blood pressure when you're talking to the doctor on the phone in the doctor's office or the dentist's office. You measure blood pressure in a relaxed environment. That's the best way of dealing with this. So I beg people to invest between $50 to $200 on a good blood pressure machine that's approved by Canadian Hypertension Society. Learn how to use it and use it. And this is remarkable benefit. And you can see that most of the blood pressure pills have gone generic, so they're not very expensive. And most people require combinations of 1 to 3 pills to lower their blood pressure effectively. What you haven't showed here is that lowering blood pressure at nighttime may be more important than the daytime. That's a talk for a different time right now. So lowering blood pressure, understanding what your pills do, and realizes, as you point out, Simon, and others, is that they affect potassium, they affect kidney function. You need to measure, and so that's why you need to have lab work. So thank you for sharing this result. Let's go to the next slide.
Here is just another study, another metadata analysis on how blood pressure can affect the risk of cardiovascular events. And again, the data has shown that for every 10 millimeter mercury of reduction in BP, we have seen a 20% reduction for events, and specifically 17% reduction for coronary heart disease, 27% for stroke, and 28% for heart failure, and a 30% reduction of the mortality rate. Yeah.
This is huge. And look at this. It actually prevents heart failure. It prevents stroke, and it has a good effect on heart attacks, but it's better effect on stroke. It's a better effect on heart failure. If the heart pumps to a higher output pressure, the heart tires out and it will eventually fail. And we know that, blood pressure is important for stroke. And so thank you for sharing this really important information. my question. You go to Chad and I we went to Costco over here, so you get the Voltaren cream for your arthritis. You can walk more. You can get some of these vitamin cocktails for $10. You can buy a blood pressure machine for $75 here. And don't forget to pay tax on some of these things here. What do you think you get better value for? I'm going to argue very strongly. Get a blood pressure machine. And get out there and walk and be on a DASH diet, but get a blood pressure machine and make sure it's approved by King Hypertension Society. Again, machines somewhere between 50 to 200 automatic machines. Get them. If you don't know where to get one, we can talk about this, but really getting the right size cuff can be important too as well. And blood pressure will fluctuate. Next slide, please. So again, is that we have all these medications, so they always have both names, and they have good things for medications. Beta blockers are now used for congestive heart failure, and they're used for hypertension, especially in younger people. Yes, they can have side effects. They can slow you down, but you can also make you live longer. It's one of the few categories of medication that make you live longer with congestive heart failure. Next slide, please. Again, they're all quite generic. They're all quite really inexpensive. So it's important that you bring up cost of medications, because there are some trade name blood pressure pills that cost $1 a day plus. And you can do the same for a fraction of the cost. And so don't be afraid to talk about costs. And I'm one of those people that I split pills. I give it 3 times a week. I can make things more effective for you. And so I can tell you when it's a good thing to do that. Next slide, please. We have lots of things on diabetes. Has gotten complicated. So I'm not going to spend too much time talking about this. This is complicated. We have good videos on diabetes. I'll refer to the next slide, please. And you can see, but the problem is the cost of these medications. They're expensive. So, is that we have categories called DPP-4 inhibitors, which are about $2 to $3 a day. We have the SGLT2 receptor antagonists, are $3 a day. Metformin is dirt cheap at 3 cents a day, and we have the glucagon agonists, which are quite costly. You can see even more costly, and where they fit in. I'm not sure if you put dimicron in this, but dimicron is pennies a day too as well. It's a sulfonylurea. It's been around for a long time, and it certainly has its role to play too as well. So don't be afraid to talk about costs, and look at our videos on diabetes to help you with that. Next slide, please. And here's actually one randomized control trial called Carolina. It compared a sulfonylurea, which is an old-fashioned drug, which is 10-20 cents a day, versus a DPP-4 inhibitor with $3 a day, and it showed at the end of 7 to 8 years no difference in outcome measurements. So it didn't prevent any more diabetic complications. You just saw a little bit more weight gain with sulfonylureas and more hypoglycemia. So if you're prone to that, that can be important. But you can see is that we have many options, this trial actually compared DPP-4s to sulfonylureas. So that's a little typo error over here. And this is good randomized data, and most physicians aren't aware of this, and something that you need to know about. Next slide, please. Now, what I'm saying is, you want to be healthy. This is what your plate has to look like, and you can see my last. I remember Paul was talking. This is Paul made breakfast. We played tennis, and we made egg white omelet, lots of vegetables, and you can see my nutritional, my chemical structures. There are basically, you have some barley, you have some oats, you have some oatmeal, chia seeds. And these are very important for your management of your blood pressure and your well-being too as well. What's called the DASH diet. Next slide, please. You can be healthier by eating well, and if you just rely on your comfort zone, it will kill you. You need to come outside your comfort zone. You need to learn new skills. Commitment, what transforms a promise into reality. So the reality is that we have phenomenally good medications. We can't forget lifestyle changes, and you need to talk to the people who are the experts on this. And there's so many opinions about this, and I'd be glad to give you more and get from other people too as well. But I spend my life thinking about this, and I'd love to share that with you. Next slide, please. Is that we have Ginny and her team has put together about 7 or 8 diabetic videos. They're phenomenal. Look at them. They're more than most doctors know. The field has changed tremendously. We have a recent 17 big randomized controlled trials now in diabetes with diabetes medications. We learned so much about that because diabetes affects the brain, the kidneys, not the heart. So there's so much to think about. It crosses everybody, from your pharmacist to your family doctor to your kidney doctor to your neurologist to your cardiologist. And cardiologists have now become interested in diabetes medications because that's until recently these drugs did not have a major impact on overall mortality for heart disease and stroke. Now we can change all that. Next slide, please. So I encourage you to look at these things. Now we have lots of puffers, for instance, for COPD right now. Puffers don't make you live longer, they make you feel better. If you want to live longer, you've got to stop smoking. The puffers can make you feel a little bit better, but they're not going to make this all go away. In asthma, puffers, inhaled steroids make a huge difference in mortality, decrease inflammation. Next slide, please. So remember, there's so many things to think about. Warfarin's been around for a long time. It costs pennies a day, decreases stroke by about 70%. We have the newer agents. Next slide, please. The NOACs. They're about $3 a day. They are safer by decreasing frequent bleeds. They're more convenient, but they're both very good choices. And the value of traditional Coumadin, you can monitor the RNRC if you're taking it. The NOACs, if you're not taking the drug, we have no way of telling if you're taking it like that. So you can actually hide that from your physicians very well. So we have so many choices, so many options. It's great. And we have some safety data with these newer agents too as well. But you pay a high price for them. Next slide, please, or a higher price. Again, the cost, 10 cents, $3 a day. Yes, there's less intracranial bleeds, no routine monitoring, but sometimes monitoring is a good thing. So to me, if you're going to have hypertension, high blood pressure, the best blood pressure you measure at home in a relaxed environment. And so we have many options. Next slide, please. And they're all complementary and different. So again, is that we have very effective therapy. Are these side effects real or not? Let your physician know. The way to know that for sure is to give placebo and fake pill. So Margaret, Simon, Maria, before I die, I've been planning this. I'm procrastinating about this. Is that if you're sore on your cholesterol pill, I want to give you about 4 boxes, 2 real pills and 2 fake pills, and then find out for sure, am I making you sore, or is life making you sore, is the internet making you sore, and so we need to find that out, and we'll do that. The problem is the trial right now to do 500 patients will cost me $90,000. I need to find a way to do it at a better rate. I got to find out for you. And blood pressure, you got to know what's going on. Is that you need to know what your potassium. You need to know what your heart rate is and your blood pressure is. Next slide, please. Lots of things to think about. Exciting time right now when it comes to medication, but you have to monitor when it comes to glucose. Diabetes with traditionally lower blood sugar. But they do have side effects at different endpoints. COPD, stop smoking, and puffers can be helpful. If you have atrial fibrillation, being on any anticoagulant lowers your risk of stroke by about 70%. And that's important. Next slide, please. So we could argue which is the best, but take your medications properly and realize what's going on here. Is that does anybody want to say something about this taking medications here? This slide here. Who's talking about it? Go ahead.
Sure. It's Monica. So we have a lot of times people might have questions about how to take medications, how many pills you want to take, and all these things. And this is information that you can get from, first off, your doctor when they're prescribing them, and then the pharmacist, again, will reiterate the application of the medication. But there's a few things that you want to keep in mind when you are taking medications to ensure that they are being effective in your life. So first is to have the routine. Create a routine that helps you remember to take your medications. So whether that means having the bottles right out beside your bed so that you remember once you wake up, or if that's having little notes around the house, create some type of routine or remembering ways to take your medication. And also, Dr. Kearney mentioned letting other people know what medications you need to take and when. Because when you have that support system, that will help you ensure that you're staying on track with your routine. Taking them consistently and trying not to skip days. Of course, we all have times when we do forget. So it's important to try to be as consistent as possible, have them labeled and in a clear way, and have your updated list. That way you're not confused when you go to take a medication, which dose am I taking? If you have your updated list, you can always refer back to that, and it's really good to have that resource. Also, make sure that you're looking ahead if you need refills. If your medications are about to expire or you need a refill because you're going to run out, then make sure that you're looking ahead. Maybe have a reminder for yourself at least a few weeks before it does run out so that you're able to call, whether it's the pharmacy or the doctor, to make that appointment to refill your prescription. And finally, it's important to know what medications you are taking, because it will help you. Perhaps it will help you in remembering to take it, and it's also good to be educated. It's such a pleasure that Dr. Kernew is hosting these webinars for us so that we can all be educated and form this community support, and learning together, and making mistakes but also growing from those mistakes, and taking care of our health better as a community. So in terms of the actual taking your medications, when you are prescribed the medication, each pill bottle or box is labeled with your name, the instructions for how often to take this medication, whether you need to have refills or not, the expiry date, and the pharmacist would review all these things and tell you specifically how to take this medication. And I'm sure if you've purchased medications before at the pharmacy, you would be familiar with seeing a label similar to this one.
So, remember, people, for the way my electronic medical record works, we actually fax everything. So I need all the information, the name of the pharmacy, the address is important. We've actually have hundreds of pharmacies, and we search by name. So when you call up, wear your glasses, have your pills in front of you, have your healthcare card in front of you, so there's all the information. And make sure you know the fax number of the pharmacy so we can actually fax it directly there. And start off with the address. Have that all at your fingertips, and that's important to have that. Thank you.
Yeah, that will definitely help ease the prescription refills or whatever Dr. Kernew needs to do to be able to help you. So help him help you. So now, something special about medications is that it can actually be harmful if, for example, specifically for type 2 diabetics, if they are feeling ill, they are more prone to become dehydrated. And becoming dehydrated is difficult. Like, you need to make sure that you're taking fluids and all that stuff, and some of the medications you take can actually cause those symptoms to become more severe than help you. So there's something called SADMANS that identifies which medications you need to be wary of taking, especially when you are feeling ill, especially if you're dehydrated, hypoglycemic, or if you're experiencing diabetic ketoacidosis or hyperosmolar hyperglycemic state. The specific symptoms you want to look out for if you do have type 2 diabetes is the dry mouth, thirst, unusual fatigue, shaking, sweating, or a higher heart rate. And the ketoacidosis symptoms are listed on the next slide. So you can probably pause the video here if you want to go through each specific symptom, but it's all overall generally like having that excessive thirst and feeling dehydrated, maybe even some shortness of breath. So if you're feeling ill, you want to be aware of these symptoms, because this is when it's going to be an indication to stop some medications.
So just backtrack, go back one slide. This is called SADMAD. So this is actually very important for people taking different categories of medication. So if you're a diabetic not feeling well, you need to know your blood sugar. And if your blood sugar is high or low, you need to react to that. So things like sulfonylureas. Now, also, you need to know your blood pressure, because if your blood pressure is low, you have to stop, your ACE diuretic therapy. If your blood sugar is low, you have to stop your sulfonylureas. Metformin can put you into renal failure if you're not careful. Anti-inflammatories are always a bad category of medications, especially when you're dehydrated. So this is important that you actually, that's why if you're taking these medications, I come back to, remember, for that special at Costco for the blood pressure machine, get one. is that it's, and 90% of us will develop hypertension over a lifetime. So just pause if you're ever taking, these are some categories of medications. You need to know your blood pressure, and sometimes you need to have some blood work done too, because it can affect the potassium, the kidney function, the sodium number too as well. So that's important to look at that. Again, we explained a lot of that, and Monica did some fantastic videos in congestive heart failure. Jenny did some fantastic videos with diabetes. I don't want to repeat those, but it's really important to repeat this and highlight that. Next slide, please. And these are the symptoms, and again, they're all explained in our diabetes video, and you can look at that. Next slide, please. And again, and when in doubt, call your doctor. If you're really sick, you go to the hospital. But these are things that you need to be aware of. Next slide, please. Again, these are the categories of medications, the sulfonamidase inhibition. You can actually pause through that to see if you're taking any of those medications. Any Pril is an ACE inhibiting drug, and that can affect potassium, blood pressure, renal function. Next slide, please. D for diuretics. These are the water pills. If you're dehydrated, you want to withhold your diuretics for those periods of time. That's why having a scale and weighing yourself an important day. Metformin is a very interesting medication that actually, if you're dehydrated, your kidneys aren't working, there's a rare entity you can get called, you can form acid in your bloodstream. Pretty rare, but if you're feeling sick, you should pause your metformin for a period of time. Next slide, please. And when in doubt, you just call your doctor. ARB are any you can see the sartans in the world. They can, and of course the anti-inflammatories. These are medications. If you're dehydrated, feeling sick, they should be stopped at this point in time, because you can have worse outcomes if you can keep them going. Again, you can pause and look at this where it does. And one of the newer categories of medication are the SGLT2 receptor antagonists, as are listed here. They should probably be paused too when you're dehydrated. Next slide, please. Again, when you're not feeling well, you just have to watch what you're eating and drinking. Drink lots of water is a good thing, and just slowly hydrate yourself. If you can't hydrate yourself, go to the emergency room. Next slide, please. Again, these are all done very well in our video, so I won't belabor this. You can look at it elsewhere, but it's a good reminder. The number one beverage right now is water. Water. If your blood sugar is high, drinking Coca-Cola, lemonade, orange juice, you're putting some nails in your coffin. If you're dehydrated, water first. Next slide, please. Who's going to talk about this slide?
Yeah, so it's important to monitor your blood pressure for everyone in general, not just for the type 2 diabetics that we were mentioning for SADMANs, but overall, remembering to take your blood pressure, as Dr. Kearney mentioned, it is a good investment. And make sure that you're writing down what your blood pressure is, and we kind of have an example of a log near the end of the presentation. Also checking your pulse, which can be checked with the blood pressure machine. Checking your blood glucose if you do struggle, if you have diabetes and you're taking the diabetic medications. That will ensure that you can monitor your symptoms, and if it's higher or lower, you can take the appropriate measures to kind of balance it out and make sure you are taking the medications that you need to. Also, checking your weight is very important, and that's also something you want to track, because sometimes it will help also with like the type of medications that you might need to take, and you can also monitor your overall health. Also, make sure that you're logging significant changes in your health. So if you're noticing one day you're feeling a specific symptom, write it down so that when you go to the doctor's office, you can remember what you want to express to Dr. Kearney. And also just a general reminder for healthy eating and exercise, and that's the point of these webinars, and just promoting and being educated to take the right steps towards that healthy lifestyle.
So how often you weigh yourself as an individual basis? I think for me, I weigh myself every day at this point in time. For people with congestive heart failure, they should weigh themselves every day, because if you can accumulate fluid, you might need to adjust your water pills, your diuretics. And if you're finding a scale for weight management makes you terrified and makes you depressed, then maybe you shouldn't weigh yourself. But if you use a scale to help motivate your progress and check your gas tank when your gas, I find that my weight can fluctuate quite a bit, but I find it's a motivating factor right now. So I'm really trying hard to live longer and be healthier, and one is my weight. So I don't care if your scale is inaccurate. If you have the same scale every day, same time, same clothes, same way, you're great. Next slide, please.
Okay, so
That's it.
now so let's talk a little bit about blood tests now. So first of all, it's really important for patients to regularly get their annual blood work done, or even more regularly than just once a year, especially if you're a heart patient. And blood tests are really important because they help doctors check for certain diseases and conditions, and they also help check for the function of your organs, and they show how well treatments are actually working for you. So more specifically, blood tests can help doctors evaluate how well your organs are actually working. They can help doctors diagnose diseases and conditions like cancer, diabetes, coronary heart diseases. They also help physicians find out whether you have risk factors for heart disease, check whether medicines that you're taking are actually working for you or not, and they also help assess how well your blood is clotting. So doctors can't actually diagnose many diseases or medical problems with blood tests alone. So doctors may need to consider other factors to confirm a diagnosis, and these factors could be anything like signs and symptoms to medical history, vital signs, and so on. But when it comes to how often you should get blood work done, the standard procedure as a patient at this clinic is to get blood tests done at least 2 weeks before your scheduled appointment with Dr. Kernew. If you're a diabetic, you will also need to get a special blood test to check your HbA1c every 3 months, which will tell Dr. Kernew your average blood glucose or sugar levels for the last 2 to 3 months. So that's a little bit of an introductory to blood tests. Well, we can move on to the next slide. So now let's talk about the different types of blood tests that your doctor may ask you to get. So some of the most common blood tests are a complete blood count, a basic metabolic panel, blood enzyme tests, and blood tests that assess heart disease risk. So the complete blood count is one of the most common blood tests, and it's often done as part of a routine checkup. And what it helps detect is it can help you detect blood diseases and disorders like anemia, infections, blood cancers, immune system disorders, and so on. And this test measures different parts of your blood, like red blood cells, white blood cells, platelets, hemoglobin, the hematocrit, and it tells you the mean corpuscular volume. So just a very brief background, red blood cells carry oxygen from your lungs to the rest of your body, and an abnormal red blood cell level may be a sign of anemia or dehydration, bleeding, or another disorder. Then you have your white blood cells, which are actually part of your immune system, which is responsible for fighting infections and diseases. So an abnormal white blood cell level may be a sign of infection or blood cancer or an immune system disorder. So the complete blood cell count measures the overall number of white blood cells in your blood, but you can also get a complete blood cell count with the differential, which looks at the amounts of different types of white blood cells in your blood. And then hemoglobin is an iron-rich protein in red blood cells that's responsible for carrying oxygen. And if you have abnormal hemoglobin levels, that's another sign of anemia or sickle cell anemia or thalassemia or other blood disorders. And then if you have diabetes, excess glucose in your blood can actually attach to hemoglobin and raise the level of hemoglobin A1c, or otherwise known as HbA1c. And that basically provides an overview of your blood sugar. And then the basic metabolic panel is a group of tests that actually measures different chemicals in the blood. So these tests are usually done on the fluid or the plasma part of your blood, and these tests give doctors information about your muscles, including your heart, and then also information about your bones and organs like your kidneys and liver. And the basic metabolic panel includes blood glucose, calcium, and electrolyte tests, as well as blood tests that measure your kidney function. So some of these tests may require you to fast, so not eat anything before you take the test, and others may not. So the blood glucose levels that are shown in these tests actually indicate the amount of glucose in your body at any one particular time. And abnormal glucose levels in your blood is a sign of diabetes because your body is not metabolizing or using the glucose for energy as it normally should be. And then we have our blood enzyme tests, and enzymes are basically chemicals that help control chemical reactions in your body. So there are many blood enzyme tests, but I'm just going to quickly touch on blood enzyme tests that are used to check for heart attacks, which includes troponin and creatine kinase, so CK test. So troponin is a muscle protein that helps your muscles contract. And when muscle or heart cells are injured, troponin leaks out, and its levels in your blood rise. So, for example, blood levels of troponin will rise if you have a heart attack. So for this reason, doctors often order troponin tests when patients have chest pain or other heart attack signs and symptoms. And in this way, similarly, a blood product called CKMB is also released if the heart muscle is damaged. So high levels of CKMB in the blood can also indicate that you've had a heart attack. Then finally, moving on to blood tests to assess heart disease risks. Most commonly, these include a lipoprotein panel, which is a blood test that can help show whether you're at risk for a coronary heart disease. So this test looks at substances in your blood that carry cholesterol. So the lipoprotein panel gives you information about your total cholesterol, your LDL cholesterol, which is known as the bad cholesterol, and it's the main source of cholesterol buildup and blockages in the arteries. And the lipoprotein panel also gives you information about how much HDL cholesterol you have, which is otherwise known as the good cholesterol. And it helps decrease blockages in the arteries. And then lastly, it also gives you information about triglycerides, which are a type of fat in your blood. So abnormal cholesterol and triglyceride levels may actually be signs of increased risk for coronary heart disease. So we can move on to the next slide. So now let's talk a little bit about what to look out for in your blood work and what tests to stay on top of if you're taking certain medications. So for example, if you're on cholesterol medication, then you need to make sure that your lipids are being checked at least twice a year, including your liver enzymes. If you're on any diuretics, then it's really important to make sure that your renal function is being checked and your kidneys are working really well, which is usually which is why sometimes we will look at EGFR for that and electrolyte levels for kidney functions. If you're on ACE inhibitors, again, you want to make sure that your kidneys are working well, so we'll check for renal function and then electrolyte levels as well. If you're on statins, then we'll look at liver function tests, and if you're taking warfarin, then we look at INR every 3 months. If there's any others that Dr. Kearney wants to point out, then please feel free to do so.
Kind of interesting. So for the INRs, it really depends on you. When you first start warfarin, you need to get done probably twice a week and more often, but once you're stable, every 1 to 4 weeks. So I probably wouldn't let it go more than a month before testing INRs, but everybody's a little bit different. On thyroid, maybe once or twice a year. The number one reason for measuring lipids on statins is not for side effects, it's to see if you're taking your statins. The chance of a statin killing you is less than 1 in 2 million. The chance of the statin saving you is astronomically high. It lowers the risk of heart disease by low dose by 20%, high dose by 50%. So this rule for every 1 millimole reduction of LDL vascular events fall by 20%. So if I have an LDL cholesterol of 4, I go down to 1, I lower my risk of heart disease by 60%. We have this number of 2 being a good target of LDL cholesterol, but from 2 down to 1, you lower your risk of heart disease by an additional 20%. And the trials that look at regression trials show an LDL less than 1 can cause some regression. Spironolactone is one of the more dangerous drugs that we use because it can cause potassium rises pretty quickly. So Monica pointed out the SADMAN's algorithm. So if you're not feeling well, you're feeling sick, spironolactone should be put on hold till after you're feeling better. So it's one of those drugs I tend to stop. It's a tremendously good drug for high blood pressure, congestive heart failure, antifibrotic agent, but it is affected by the kidneys, and potassium could be an issue. Things like ACE, ARB therapy, it really depends on what you're doing. So if you're stable, you don't have to measure it too often, but if you're sick, you need to measure it more often. So thank you for sharing those insights with us, Kushi. Next slide, please.
Yeah, so let's take a look at lab requisition forms really quickly. So basically what this is it's a form that combines patient registration information, specimen information, and it's a physician order that is basically used for confirmation of testing. It should be completed by the physician or authorized staff and signed by the ordering physician. The image on the left is a sample lab requisition that we made up for Dr. Kearney. And you can see the values that Dr. Kearney normally likes to request when getting a blood test. They're highlighted with a red box around them. So these tests include lipids, HbA1c, creatinine, EGFR, sodium, potassium, a complete blood count, and other tests such as TSH, CK, and BNP. Lipids are really important to track because they indicate your blood cholesterol levels, and then HbA1c, like I mentioned before, is used to assess blood sugar, and creatinine and EGFR are good indicators of kidney health, so which is why Dr. Kearney likes to keep tabs on all those values. Electrolytes like sodium and potassium are also really important to look out for kidney health and if you have high blood pressure or heart disease. So let's just quickly talk about how long a requisition is actually good for. So if the form is dated, then it's only good for 6 months after that date. However, if it's undated, then it does not expire. So with that said, we can actually email you undated lab requisitions directly now through a program called Midios. I don't know if I'm pronouncing that right. You can correct me if I'm not. But yeah, it's basically this program that we can use to directly send you these requisition forms to you. And you can print these out, and you can print out multiple copies and just keep them with you, which is incredibly convenient. So you don't have to call in every time. You have access to these. So when you get your requisition, you always want to make sure that you double check the demographic information that's been printed on it, like your address, your name, phone number, as well as your family doctor's information. Another really important thing to remember when it comes to getting blood work done with Dr. Kearney is that you have to make sure that if you want to review your blood work with Dr. Kearney and you want to discuss your results, then you must call the office and make an appointment. No news does not mean good news. It just simply means no news. So you must make us aware that you've gotten blood work done because it's incredibly difficult for us to keep track of all that information for every single patient. So please take the initiative to let us know and make an appointment with Dr. Kearney to review your test. We will not be contacting you ourselves. Yeah, go on.
So that's really important consideration. So first of all, is make sure the requisition is you. Let's say I made a mistake and sent the wrong requisition to the wrong person or the wrong email. Make sure you have a valid healthcare card, that your healthcare has not expired. The version codes change every 5 years because for the lab to get paid, for anybody to get paid, you need to have a valid healthcare card. One of the things is that if you don't have a valid card, you have to bear the responsibility of paying for the cost of the test. No one wants to charge you, is that the government's willing to pay for it, but you need to have a valid healthcare card. You have to have a valid driver's license, and so you have to have a valid healthcare card, even during COVID. So you need that. If you change address, change phone number. For instance, you have the right phone number. So I get called at 2 o'clock in the morning because there's an emergency potassium level of 6.5, and I get your lab requisition form has an old phone number on you. I can't contact you. Today there is a patient I've been trying to get a hold of prescription renewals for the last 3 months. Oh, I moved. I forgot to tell you. These are important considerations. They're simple, but they're important. What blood test you need, it depends on myself and yourself. So I try faxing it to labs. I try to ask people to make extra copies. But really important is that it's hard to get requisitions in this time of COVID right now. You have to basically book for most of these things right now. So I'm trying to make it simpler for you, but that comes with responsibility. I cannot adequately look after you without talking to you. So if you go for blood work under my name, is that you please call me to discuss it with myself. And I think we're also going to talk about how you can get information online. And we have lots of videos. And we're going to actually do a whole separate talk on what's in your blood. So that more to come about this. So this is just some basics here. You can see there's so much to talk about when you start about medications. They affect blood tests. We need to look at that. Anything else you want to add to that, Kushi?
Not to the requisition forms. I just have a few more slides. So we can move on to the next slide, please. Thank you. So these are just a few reference ranges to look out for certain test values. You can take a screenshot of this, or you can just come back to it later in the webinar recording. But some of the important values to keep in mind are, of course, blood glucose, cholesterol, LDL, and HDL. And like Dr. Carnew was mentioning, if you'd like to learn more about all this blood stuff, we will be hosting a webinar in the future on what's in the blood, so keep an eye out for that. That's all I'm going to say for this slide. We can move on to the next slide, please.
Well, I'm just going to pause for 1 second. One of the things, if you go back, is that people always get worried about their kidneys. So the best way you can measure kidney function called BUN creatinine. Now we use estimated GFRs, and normal GFR is usually somewhere around 90. As you get older, your kidney function changes, it declines. I don't expect to have an 80-year-old person with a normal GFR as a 20-year-old. It also changes based on your volume or hydration status. And some of the medications we get depress the GFR by dehydrating you, but they still protect you, so very much individual. So one of the numbers that you should learn is your potassium. You want your potassium in the 4 range. You want to look at your hemoglobin, if your white count. So there's online availability through Dynacare. I think it's about $10 a year, and then Life Labs lets you do it at no cost. Get signed up for it and learn how to do this. And you can see we start out with prescriptions, but prescriptions interfere or interact with blood work. So learned how to interpret that. And really is that there's no one value for one person. It's in your context. So that's why you need to have a conversation. A GFR of 60 in somebody may be very good, or maybe catastrophic for somebody else. And if you go to the next slide, when you look at kidney function, we also look at how drugs interact based on your kidney function. You can see that slide there. And also depends on protein in your urine. As your car is leaking oil, it's in bad shape. As your kidneys leak protein, it changes your kidney function. So we have different ways of valuing the kidneys by how much oil or protein it leaks, and by the actual GFR. And we need to adjust your medications based on your kidney function. So that's why medications are really important to know that. Drugs are limited to the liver predominantly and the kidneys, and that's how your body keeps that into check. Next slide, please. So much to learn, so much to think about. Again, is Dynacare and Life Labs offer this service. Who's talking about this?
That will be me.
Okay, go ahead.
Yeah, so right now, of course, it's really important to maintain safe physical distancing and avoid the chance of COVID-19 exposure. So with Dynacare Plus and Life Labs online portal, you can actually get your test results really conveniently online without making a trip to your doctor's office. So there's no worry about wait times, travel, or clouds, or anything like that. So for Life Labs, it's actually different. Sorry. So for Life Labs, it's actually free to access your test results online for Ontario residents. You just simply have to make an account on their My Results website. So you can go to that URL on the right, displayed on the slide, to get that set up. And then, so most results are available on My Results within 24 to 48 hours after visiting any Life Labs patient service centers. And then on the other hand, we have Dynacare. So for Dynacare, you actually have to pay $9.99 plus tax per year. $9.99, I mean like $9.99, not $100. So it's $9.99 plus tax per year to make an account and then to get your results and access them. But there is a discounted price of $7.49 per year for seniors who are 60 years and older. The link to create an account for Dynacare is also on the slide to the left.
So one thing that, if you just backtrack one slide there, is that if you're in the clinic, we're happy to provide you with a copy of your results, but we do not have the ability in this COVID situation to email your results. So you have the opportunity going through directly through Dynacare and Life Labs, get that information available. They do it extremely well, and when you're in the clinic, we can certainly give you a copy, but we're working 16 hours a day plus right now just to try to get through the day right now. So we don't have the ability to send you lab results at this stage by mail or by email. And hopefully that will change. It's amazing that how busy we are right now trying to keep you safe, and we need to work together on this. So next slide, please.
Yeah, so this is just a very brief patient case scenario, and Mr. Z is someone who loves to exercise, and he regularly works out and also enjoys attending biking and spin classes. Now, his recent blood work shows a CK value of 6,459. Now, if you immediately saw that value, the initial response might be to send him to emergency right away. There might be something that's happening. But he got a follow-up blood test 2 weeks later, and it came right back down to 148. So what happened? Now, his increase in CK value was simply due to 2 weight training sessions that he did earlier that week at the gym, and he was very sore and was experiencing extreme muscle soreness. So, yeah, I'm not sure, Dr. Kearney, if you want to also comment on this. It was a very surprising case, and I remember being very shocked when I first saw that value.
So doing this for about 35 years or so, I've learned to put all this into perspective right now. So when you see a CK of 6,459, most people would panic. So the first important thing is he's feeling fine. He was sore from exercise, and you had a good explanation. The things that would worry me is that if the kidney CK goes so high it's clogged your kidneys, you go into renal failure. You're not peeing. If you are peeing, you're passing very dark, cloudy urine. It's brown colored. Your muscles are weak. You can't walk. This guy wanted to go back to the gym and exercise. He's feeling great. So the first rule is that statins do cause liver CK to rise, and we also know that exercises causes CK to rise too as well. So we always put that into context. And again, is that if I prescribe you a medication you're concerned, call the office, and we'll try to deal with that relatively in a timely fashion. But this guy's fine. He's terrific, and we didn't change his cholesterol pill. We just told him not to exercise. He had a personal trainer. He's a great guy, doing all the right things. Just overdid it for a couple of days, and I've seen this more than once. His is really quite extreme. Most people, it's a few hundred to 1,000, but that was a good example. Thank you for sharing that story. I forgot about that case.
And yeah, this is, we're coming to the last few slides now of the presentation, but we just want to emphasize the importance of keeping a medical journal, and we encourage everyone to do so. Yeah, here's Dr. Kearney posing with some forms and sheets.
Okay. So one of the things is that I think everybody should have a book or lab book here. Let me just show you something. Go to the dollar store, you can get a nice one, bad one, but get something you can write your notes on. Put your medication list in there. Put important information there. You put in your cell phone too, so I'll put a lot of different places there. And write things down. This is some journaling that I did along the way, and we have a video of that we played at the beginning. This is a series of blood pressure. When you measure blood pressure, you don't measure one blood pressure, you measure a series of blood pressure. I weigh myself first thing in the morning, end of the day. My weight is different by 4 or 5 pounds. I go out biking, I can be 5 to 10 pounds lighter, just pure dehydration. Keep track of things, and really it's important is that if you measure blood pressure, do it quietly. Do it 3 times a week, three regular readings in a row. The first one is always higher. That's normal. It means you're human, and blood pressure will fluctuate. What I know is being overweight is one of the most harmful things from cancer, from heart disease, from stroke, from dementia, from infection. And basically my goal is to get people down, most people 20 to 30 pounds. If you lose 20 to 30 pounds and you have type 2 diabetes, you can put into remission. And over 70% of the time if you have it for 5 years or less. If you're diabetic, measure your blood pressure. Sign up at DynaCare or LifeLab for results and write down the questions. We'll spend time looking with you. And what we're trying to do is fax things to your pharmacist. So I need the address of the pharmacy, preferably the fax number, and learn medications. So I'm sure nobody after this discussion will ever say to me ever again, I forgot the list. I left it's the same as last time. Surely you must know, and realize that we're all going to make mistakes. You started off, Maria, saying that I think it's around less than 20% of DMRs are right. my EMR is getting better, but it's not right all the time, and people are changing from multiple sources, and so let's really find a better way of working together. Anything other, Maria and Christian, others, and all you young people have been here, Simon, others, and Stuart, been working in the clinic, and we're working very hard. Does anybody have any comments about some of these things? So get a notebook, write it down, put it in your cell phone, and remember, you're going to forget everything. And what else should we say about this? Is that send us your email address, and we'll try to send things to you that way. Monica is working hard on an app. We had over 300 responses and how we're going to design. We haven't designed the app. We don't know how to do that yet. It doesn't stop us from trying to figure out what to do, but we're going to do one. Again, your healthcare card expires. Make sure you let us know and go get it updated. Work with your pharmacy. Get a good pharmacy. If you don't have a good pharmacy, I'll get you one. I can make plenty of suggestions. Know your medications. Know what they do. And we just gave you a little bit of a hint of that. I'm sorry, poor Simon did all this work, but we'll come back and explaining all these medications. We're going to have a series of workshops on medications. But the important thing is know your pills. Know how many pills you left. Don't let your gas tank go empty. Now in the future, it won't be a gas. It will be an electric car. I know exactly what my battery in my car tells me what to do. I keep good track of it. It has reminders. I can charge up at the cheapest point in time. But also, I'm thinking about the environment, thinking of your health, and medications seem to last much longer than we thought, and good effective therapy. We're all going to forget, but also be honest and be open. If you don't care about your health, you wouldn't be here. You care about your health, care about getting healthier. What did I forget to say, Maria?
No, you pretty much covered it all. Something I wanted to mention earlier is what Paul said just in the very beginning of the presentation. Bring that back to always write down any questions you may have as well. It's always good to keep track, so then whenever we do call you for a phone visit or when you come into the office, you'll know exactly what to ask Dr. Kearney, and so you're being very proactive in terms of your health.
To me, this is one of the most important webinars that we can do right now, because I'm just seeing too many bad things happen to people, and either out of not thinking through what you can do to be healthier and how to avoid medication errors. And it's interesting that people get mad at us for going over medication lists or trying to make sure that you're safe. You should be mad at yourself for not knowing your medications properly, not taking them properly. And we're all going to make mistakes. And I don't really care about fault. It's a question of how to work better about this. And this is wonderful. So I think we'll end with this little webinar, I think, or little video we did yesterday. By the way, I have another one we have for next week. Just filmed that today. Always ideas. Go ahead. Ready for another webinar, and one of the things is that I have my notebook. Where's yours to start off with? So one of the things you might want to consider doing is measuring your blood pressure. You can see is that I have a series of blood pressure readings. The first one, 150/92, and I take a series of blood pressure readings in a relaxed environment. It comes down nicely to 118/76. So blood pressure fluctuates, should be done multiple times, multiple days. So there's mine. Weighing yourself. Everybody should have a scale. I weigh myself on a regular basis, and first thing in the morning, for instance, I'm usually around 166 pounds at this stage. I lost about 20 pounds. Towards the end of the day, I'm about 170 pounds. You can just see how the weight fluctuates throughout the day, depending on what your water intake, if your bladder is full, clothes, etc. Getting things lab results. Well, you get your lab results by two places right now. Is that my LDL is around 0.5, and LDL is less than 1. Can lead to regression of plaque in some studies. And learn how to sign up, get your results either through Dynacare or LifeLab. Learn how to do that. My pharmacist is Shoppers Drug Mart 232 Cannon Street. For our EMR to work with you, know the address of the pharmacist that you have, so to make sure we can actually fax your prescriptions if we need to do that. Know your medications. I'm taking Crestor 40 milligrams a day. I get 100 pills in my bottle at a time. It's half full, and I have one refill. Don't wait till you run out of prescriptions. Avoid being a medical error. Think about the questions you have for Dr. Kearney. So and what tests you have done or results that you want. So my last stress test showed I can exercise for 17 MET. Do I need another one is my question for Dr. Kearney. Now, COVID and there'll always be problems. My problem right now is the stress of COVID has caused me to work harder. I don't mind working harder, but I'm also finding getting more angry. I'm getting angry at my patients because sometimes too many don't show up for a test that's been pre-booked and you've been called for. That's not right at this point in time. I'm getting renewals from pharmacists, one prescription at a time. Basically, don't run out of medications. When you're down to your last medications, let us know before something bad happens to you. Is that unfortunately there'll always be struggles, and one of the things I've learned is being infections such as COVID wants to basically unfortunately kill people that are less healthier. So be healthier. This is not the time to roll up the sleeves and bad things happen to you. This time to roll up your sleeves and work harder on this. So let's figure a way to get you healthier. I lost some weight. You can lose some weight. Let's do something more importantly. My question is, where's your book? And keep track of these sorts of things. So you can actually keep things on little pieces of paper, which is fine, but I think it's better to write things in an organized fashion, keep track, and have somebody else in your family work with you. So please look at this video. This is a very important one. Look at other videos as well. They're all recorded. Let's get healthier together. I want to thank everybody for sticking on for this. I broke my rule about trying to make things an hour and a half, but this is actually really important, and there's so much to say, and that's why prescription renewals are so important. It just leads to so many things about your health and what's important to you. I want to thank everybody for putting their heart and soul into this. Margaret, do you have any other comments you want to make about this? Or I'll also ask final remarks from Maria, Simon, Monica, and of course Stuart, and anybody else who has any comments or what people have to say. So I spoke in my piece. I want the best for you. We need to work better. What we're doing right now is not good enough. I need to do better. You need to do better, and we will do better.
Can I just add one point? And this is a little plug for people who are still employed or have insurance benefits through an employer. They really are part of your healthcare team because they're paying for your medications and your other healthcare costs, dental, paramedical, etc. Without these benefit plans, would have far more people who would not fill prescriptions. So I think it's important that they, perhaps at the bottom of the list, but they are part of the healthcare team.
An important part too as well, and we're also learning how much the cost of medications are going up to as well. And so it worries me how much we're paying right now. And we have new medications that are better. We have to pay more for them, but we have to also be cost conscious about this. And so let's figure a way to take what works best for you, for your drug plan, and for your life. Works well, absolutely. So I'm going to go around. I'm going to say, Simon, any final comments?
Yeah, I think I'm good. I think we covered pretty much everything. Yeah.
Thank you for looking all that stuff up there. Monica?
No problem at all, no problem.
I think it was great. I also learned a lot being here tonight, so thank you, everyone.
And Monica's also going to be working with others and trying to design an app. And some of our priorities is medications, getting them right. You can see how difficult it is. We have our current EMRs don't work. Our current way of doing things don't work as well. So can an app help you in some way? And we have some ideas about how we can. If you're on medications, everybody in your family is going to know what medications you are. They're going to help remind you, and that's one of the things we're going to think about doing, and we'll help create that. Maria, any other thoughts at all?
Yeah, just something I saw earlier when you were talking about cost. Satinder actually made a really neat suggestion I saw in the comments. He suggested that maybe the clinic can make a drug donation pool where people donate money so the patients who are not able to afford to buy so-called expensive medication can obtain funds from the pool, including the blood pressure machines. He also said most of us donate money to charity. It's difficult to organize and monitor, but it's just a thought. So yeah, and that's just something I caught on while we were presenting earlier, and I think it is a very interesting idea and something that we could think about for the future. But aside from that, I think the webinar went very well. Thank you so much to everyone that helped create it. And yeah, it's been a while since we've had a 3-hour-long webinar. It's about time that we had another one, so this is the one. And yeah.
Thanks. And thanks for leading this one on. Kushi, any final thoughts?
No, I think the webinar was pretty thorough. We made some very important points. Just to reiterate, take initiative in your own health and be proactive. And one of the ways you can do that is remembering what medications you're taking, making those medication lists, and telling us to when you come for an appointment. But yeah, everything else I think was very detailed.
And don't run out of pills when your tank's a quarter empty. Get it filled up when you're down to your last refill. Let us know so we can actually plan that well for you. Stuart, any comments? And also, of course, you get the last word.
Sure. I was going to ask the question that was proposed earlier, but it was just addressed regarding the donations. Well, we had a number of questions today. I was answering them as we were moving along. One great point that was really brought up, though, and you talk about it all the time, is making sure that 4 or 5 people know your medication list. So somebody proposed that if you have a spouse or a grown-up child, it's a good idea to give them your list of medications. And I think that that's something that we maybe didn't share too much today, but I think it's a fantastic thing to touch upon. I can almost guarantee that your spouse or your children are just as invested in your own health as you are, maybe even a little bit more. So it takes a village, and it's a good idea for them to be able to know the medications you're on as well. We spent 3 hours today talking about how important it is to have your medications right. The pressure doesn't all have to be on you to make sure that it's right. Making sure that your family is there to verify for you, ask you questions, be educated with you, understand what those medications do to your body. I think that that's important too. So making sure that you can integrate your family members into it is a nice point that we didn't touch upon today, but it seems like some patients have already tried that, and it's a great thing to touch upon.
Yeah, I always appreciate when family members are present, either in person, by phone, and I feel really bad right now that we're in an era right now where we have to limit the amount of people coming into the clinic. But I think with this virtual medicine, we're actually looking at different ways of doing this, and we're going to try something different all the time. And that once this COVID situation is resolved, we're going to actually combine the best of virtual care and the best of in-clinic care. So we're going to be better. And we're all getting better, and I want to thank everybody, and fantastic evening. So thank you for all your patience, and get this a few times. That's great. We're going to let you go. We're going to stay on and just discuss amongst ourselves a little bit. You're all welcome to stay if you want to. I bid you a wonderful evening, and looking forward to our next presentation. Have a great night, everybody.